Welcome everyone. So we have a very good, we had a very good session on how to, have healthy, delicious foods, which are healthy and delicious. No need to cheat. You do not need to stop your cravings. You can just change the ingredients, and that is the culinary science. And actually, culinary medicine is coming up big up. I would now like to call upon Dr. Sanjeev Khanna sir. He is a gastroenterologist at Holy Spirit, Hiranandani and Criticare hospitals. I would say you are a teacher past par excellence, which you have not written here, but the way that he explains, you feel like you are sitting in your MBBS and MD classrooms, and the way that he explains those. He is a senior advisor of Pan India Mumbai chapter, avid sportsperson, passionate dog lover, dedicated teacher, and a reliable friend. So in the second part of this CME, we are going to go deeper. In the first half, we told you about the lifestyle medicine, and now we go deeper. So Dr. Anand Kumta will be covering about the diabetes. Is it reversible? Sir is a senior consultant vitreoretinal surgeon. He's done his fellowship under P.N. Nagpal for Retina Foundation and double FRCS, expert in micro-incisional vitrectomy, trained and mentor ophthalmologist, is a speaker at Mumbai state and national conferences, and also an advisor for Pan India. He also walks the talk. So whatever he's going to tell you here, he has done it for himself. Dr. Kiran Kulkarni sir, we all love his meals, the plates that he sends. We actually wait every single day what is going to come next for the breakfast platter, lunch and the dinner platter, and the ideas that sir and ma'am give. He is a senior consultant ophthalmologist, done his MBBS from the TN Medical College, Mumbai, teaching faculty at the same college. And he's a consultant ophthalmologist at Netran Kiran Eye Care, and advisor for Pan India Mumbai chapter. Yeah. Welcome, Dr. Khanna sir.
Friends, I'm thankful to all of you to be still sitting here when the world's greatest sporting rivalry is just 15 minutes away. That shows that we are really a dedicated and hardcore, whole food, plant-based diet followers. Oh, you fixed it? All right. So, Yes, yes. Dr. Kiran told me that, and I think he may be partly right. So my sincere thanks to Pan India and Pan International, and to their chief faculties, Dr. Rupa Ben, Dr. Sharang, who's here, Dr. Rajina, and Ms. Rinki Singh, who's come all the way from Delhi, and a whole lot of other people here who are so active, Dr. Anuja, Dr. Smriti, Dr. Kiran, Anuradha, Ram sir, and all of them. My apologies to some of you who must have heard this talk a few months ago, but believe me, some of the slides are new, and some of the jokes are also new. So, one does change over the years, and when you come to an institution, suddenly you meet some old friend of yours who was with you years ago, and then she looks at you, and she looks at you up and down, and then she says, "Oh, you're Sanjeev Khanna." I said, "Yes." So I said, "You?" She said, "You didn't recognize me." I said, "No, sorry." She said, "I am the same one who used to, always throw chalk on you from behind in the MLT." I said, "Yes, I had a lot of hair that time, and I never realized that he was throwing it." So she remarked wistfully, कि दिल की तमन्ना है कि तुझे पलकों पे बिठाऊं. दिल की तमन्ना है कि तुझे पलकों पे बिठाऊं, पर तू 82 किलो का हो गया, ये दिल को कैसे समझाऊं. Ladies and gentlemen, a gastroenterologist handles people's guts day in and day out. We scope them, we feel them, we do all sorts of things to them. And we are somewhat hardcore technocratic people. There's very little of emotion and that soft part of medicine in our heads. So when Dr. Anuja, she's, I find it very difficult to say no to a pediatrician, especially when she's so lovely and cherubic. And she implored me, you have to speak. I said, yes, I will be there. But when the topic came up as gut feeling, I was feeling कि ये किधर पहुंच गया मैं. And it's more to do with something in the mind. It's more to do something with psychiatry or what we call gastro-neuropsychiatric type of situations. You know, you get that something called the sixth sense when you meet somebody. ये बंदा सही है कि नहीं, अपने साथ जमेगा कि नहीं. You get, so that is what is really a feeling in the gut. And you tend to associate it with the mind. And then I tried to look up what is the mind. And I looked and the answer came, never mind. Ladies and gentlemen, you can see, and my friend and my Didi sitting here, Dr. Shobna Bhatia, will also agree that gastroenterology is one of the most unglamorous super specialties. You must have heard hundreds, thousands of shairis to the heart, to the brain, etc. Have you ever heard a shairi to the rectum? Not done. You know, if someone writes that, let me know. I'll compile his whole poems and we'll present it in the next meeting. So cardio, neuro, these are glam sciences. Next slide. So we talked about gut feel and we'll talk about what it is. And next slide. And this is what is called the gut-brain connection. So what really is a gut-brain connection? You know, we are all familiar with it. There are certain terminologies which are there in our language. Pet mein chuhe daudna, butterflies in the stomach, you know, all these things. I feel it in my guts. So these bring out compellingly the gut-brain connection. These are very simple things, but we know it from day-to-day practice. I remember in the 70s and 80s, before the exams, the medical shops outside used to have stocks of Dipendal, Mexaform and all that, because overnight you get diarrhea. And the stocks would get all sold out. Now there can't be a sudden epidemic of dysentery coming overnight. Obviously, this was nervous diarrhea. So again, the brain acting on the gut. And very simple, you go from here to Goa by one of those old buses, the driver refuses to stop, whether you have a number 1 call or a number 2 call. मैं अपने stop पे रुकूंगा. And you immediately use your external sphincter over which your brain has volitional control. Again, a brain-gut connection. Very simple examples, but day to day. We all understand when we've been through these personally. So we have this whole new field called the DGBIs, disorders of gut-brain interaction. And these were in the past called FGIDs, or functional gastrointestinal disorders. So these were replaced by this new bombastic term called DGBIs, because when we say functional, you know, you're looking at a patient condescendingly. ये जरा functional patient है, जरा संभाल लो, psychiatry में भेज दो, इधर कर दो, उधर. So when you say disorders of gut-brain interaction, it suddenly gives it a very big, you know, very authentic and a very real life situation comes in. And how do these disorders come around? We all know that there's an old saying that all roads lead to Rome. So there is something called the Rome criteria, which they make. And the last Rome criteria were made in 2016, which are called Rome 4. So before that, Rome 3, 2, 1 were made. And you know, Rome being such a romantic place, gastroenterologists would love to go there, have a nice holiday, make criteria which make our lives tough and miserable. Because you lay down 1, 2, 3, 4. Now, irritable bowel syndrome, when the patient walks into my room, I know this is IBS. But I have to see that he fits into those criteria. So that is how the whole thing starts. So DGBI is disorders of gut-brain interaction. And so this whole thing of condescending is over. You call this, you give it a real life name, and we know that there are real life situations behind it. For example, we used to always think that irritable bowel is in the brain, but now we know that if you get a GI infection, significant number of us will continue to get diarrhea for weeks after that infection is over. And this is what we call post-infectious irritable bowel syndrome. So in the past, what was called, there were two categories when we were students, organic and functional. Now it's no longer that. I always think how much of both a patient has. And every patient, an organic patient who's sick for a long time, will develop a functional overlay. And a functional patient, we know that a sudden sense of anxiety, fear, whatever, can give you a myocardial infarction. So what more do you need to connect the brain and the body? So irritable bowel syndrome I can use as a prototype of the drug gut-brain connection. And often patients come and ask me, Dr. Saib, mane IBS છે, irritable bowel syndrome. તમને ખબર હશે ને શું છે? I said, હા, મને ખબર છે. શું કામ થાય? I said, મગજ irritable હોય ને તો gut પણ irritable હોય. After that, they don't ask me too many things. Of course, we know that these things are no longer true, and a whole lot of research has gone into this, and there is real organicity also behind all of this. If you went into a very famous book, which all of us have held, the Oxford Handbook of Clinical Medicine. It's a great book, yellow, small tome, which could fit into your apron pocket. Very nice one-liners, very nice take-home statements, axiomatic statements. Irritable bowel syndrome, just a couple of editions away in Oxford textbook. It's a disease of unknowns. The etiology is unknown. The pathogenesis is unknown. There are no investigations which prove it. And there is no known treatment. You can understand what we are dealing with. We are dealing with totally abstract diseases. And under that, there comes a whole big list of diseases, what are now called disorders of motility, etc., etc. However, what we now find is that there is a heady combo of altered gut microbiome. Next, yeah. Okay. Gut dysmotility, visceral hypersensitivity, altered immune function. 80% of the immune cells lie in the gut. And these are what go into the etiopathogenesis of these disorders. Of course, I don't want to take you into each one of them because I know the coffee maker is there out. Many of you may just walk out to have coffee. So I will deal with gastroenterological diseases with a bird's eye view. This is our very famous tune. Of course, this is from McKenna's Gold, which we all seen, most of us as kids, and the tune was from Good, Bad, Ugly. And you can see that, next, Iram. You can see that this is what the gut looks like. We all know this. It's a long reptilian tube, almost 30 feet long from one end to the other. And you have, if you spread it out cell by cell, it'll cover a tennis court, which is almost 4,000 square feet. So you can see that you have a huge absorptive area which nature has given you. Next. And just like any system, you have a hardware and a software. So you have a hardware which is there on your left, and you have the software coming up, the physiology, the hormones, the neuropeptides, and the microbiota. Okay? The new kid on the block, the flavor of the season. Of course, it's no longer new. It's been there around for a long time. But we still keep dwelling on it because the number of papers and the research publications on this is just mounting day by day. Next. And you can see these are delicious things which are lying on the left, which we as plant-based doctors really enjoy going to town. You pass them through this reptilian tube and see what comes out at the other end. Okay? Okay? We have to be careful. I don't use words nowadays, especially, I know that I come from an area near Allahabad, so I don't want to use anything which is politically incorrect. Next slide. So there are more bacteria in the human gut than all the human cells. And there are 1,000 known diverse species. So the bacteria must be talking to themselves and saying, अरे यार ये नया बंदा कौन आ गया आज अपने को लेके जा रहा है, देखो कम है अपने अंदर, बहुत लोग कम हो गए. So compared to our ancestors, our bacterial diversity has come really down. Next. And I can't even count these figures. That many of those microorganisms in our gut digest our food, regulate our hormones, eliminate toxins, and produce key nutrients. Next. And these are the beneficial effects of the gut microbiome. So this is now considered like an organ by itself. There's a separate organ which is much more than the genomic component of the human body. And you can see that it has metabolic function, a whole lot of them. It ferments, it transforms bile acids, it produces vitamins, extracts energy, it resists colonization. Very, very, very important. When you have a good, healthy microbiome, you eat whatever, nothing happens. And the same food somebody else with a bad microbiome eats, and he falls sick. Okay? You'll find many times your patient telling me, बाकी लोग तो सब मेरे साथ खाए, उनको कुछ नहीं हुआ, मेरे को क्यों हो रहा है? You know where the fault lies. They produce antimicrobials. Of course, your own cells also produce antimicrobials. You have the Paneth cells which are lying at the base of the crypts of Leiberkun in the small intestine, which produce your own defensives, your own lysosomes, which kill bacteria. You have your own good antibiotic system in your body. We still walk, and I'm sure Dr. Anuja will back me up on this. You go to a pediatrician with your child who's having a small respiratory infection, and you're not satisfied till she writes down a couple of antibiotics for you. You walk into any pediatric ward, and for a simple gastroenteritis, you will find 3 antibiotics and 1 metronidazole going on. Most of the time not required. The structural and histological function, epithelial cell growth, the tight junction permeability, which I will dwell on a little later, and so on and so forth. Next. So you can see that there are almost 100 million neurons in the gut, and that is why it's also called the second brain. I wonder how they counted all of those, but there must be some way they had. Okay, so the gut is called the second brain, and I'll dwell on that also. Next. How do bacteria become part of us? We have normal vaginal delivery. Show me that point. Okay. If you have a normal vaginal delivery, you get your mother's flora into you, and when you're born, your gut is sterile. But the mother's flora is what really nourishes your gut and is the normal way it should happen. There are places now where the cesarean babies are being bathed by the mother's vaginal secretions to help them to repopulate their gut with good flora. The mother fondling, kissing the baby, Mother Earth, from which we derive most of our things. Okay? I find especially my patients who come from the US getting aghast. Oh, my son is on the carpet. He's going to pick up a lot of bugs. I said, don't worry, nothing will happen. You know, those bugs are good for him. Okay, if something happens, you'll handle it. I said, yes, I'll handle it for you. Don't worry. Okay? It's found that homes with more than one pet have a lesser incidence of allergies in their kids. Next slide. And we dwelt on this before. So you have about 23,000 genes in the human genome. You know, Craig Venter did that studies way back. And the human microbiome is, you can see how big. Okay, next. Much more than that. And what are human beings? Next. We are a skeleton, we are tissues and water, and we are microbes. That's how important the microbes are. Next. And as we go from the stomach downwards, you can see that the microbial population increases exponentially. You have very few over here. You know that mainly you have Helicobacter pylori here, and you can see in the colon a very high population. And can anyone tell me which is the most sterile area of the human body, where there are the least organisms? prize question, Dr. Sharang. Eyes. Anything better than that? No. Eyes is not right. We have ophthalmologists here. Dr. Kumta, what is your opinion on eyes? I'm sure there are enough bacteria. Sorry? Urinary bladder. You're close. Not right, but. CSF. No, I'll tell you. Even the brain has. The answer is surprisingly, no, I'm talking of areas which are open to outside, to the external plane. Stomach has a lot, I showed you that. And the answer surprisingly is no. We have ophthalmologists here, I won't come into that, but no. You're close, the answer is vagina. The only natural organism there is the Dauderlein bacillus. There's very less, unless you go to someone and she does a PV on you and then the organism just multiply. So it's known. Next. And you can see that even the brain has colonization. So we'll come to that, why and how. But of course in a very small amount. Next. You can see what are the factors which impact the microbiome. They are diet, they are polypharmacy, which we indulge in. A lot of us, okay, everyone is on multiple drugs. And the area which you come from, the life cycle stages as you grow up, the birthing process we discussed, the feeding methods, and stress. Okay, great. Of course, we're going to dwell on something which we can control, and the diet is important there. Next. Previous slide. Go to the previous slide. The one before that. Thank you. Next. I didn't know they were so good. You're taking pictures. Include me in them. So, you see how gut dysbiosis can affect almost every tissue in the body. Okay? Obesity, type 2 diabetes, IBD, irritable bowel, rheumatoid, hypothyroid, the entire gamut of neurology, and especially the degenerative neurological disorders, Alzheimer's, Parkinson's, MS, and even atherosclerosis. So you can see that dysbiosis is everywhere and it can, how do I put this on? Okay. Right, next. And how do things go wrong? You can get an increase in pathobiont expression. Some of the organisms may not be friendly to you. You can get reduced diversity. The more you have, the more the merrier. Okay? You have lesser organisms, more likely that they'll be the bad types, and loss of the beneficial microbiomes. So the three types of dysbiosis are not mutually exclusive and can occur concurrently. You take antibiotics frequently, you're going to take away all your beneficial flora, and it may take ages before they come back. Next. So what are probiotics? We all know this. Just to recap, live microorganisms which when administered in adequate amounts confer a health benefit on the host. And what are prebiotics? Prebiotics are substances which feed the probiotics. So if probiotics are your garden, then fiber is your fertilizer. The fiber in your diet feeds the probiotics. Next. And what is, wait a minute, what is this Big Mac? I'm in no way advocating this. And the Mac here stands to be crossed, and the Mac here is what are called microbiota accessible carbohydrates. So when you take carbohydrates in close to their natural form, like Madam was first telling us, you don't break wheat into dalia, or you don't process it further, the chances of the microbiome using them to produce beneficial things like short chain fatty acids, butyrate, acetate, which are fodder, which are food for your enterocytes and colonocytes, is produced in a much better and a bigger way. So that is the Big Mac I'm talking about, microbiota accessible carbohydrates. Next. Now, if you can take a picture, you take. I'm not going to go in this slide, because even if I go into this slide, I will need coffee. Okay? You can see each one has a big definition. Then there are things about them. How do you sequence them? 16 srDNA, shotgun, RNA sequences, and liquid chromatography, mass spectroscopy, this, that. These are things for research labs which are done and they are important. But for us, possibly we just remember this. You can take a picture. Next slide. This, ladies and gentlemen, is the hallowed Seth GS Medical College, KEM Hospital, which just celebrated its centenary last week, a few weeks ago. In my entire career over there, which was graduation, post-graduation, and super specialization, Dr. Shobna will back me up. In the 5.5 years of graduation, the entire dietetics, the exposure to nutrition was for about 6 days and 2 hours a day. So maximum 10 to 12 hours were spent. In post-graduation and super specialty, Dr. Kulkarni is here, and I'm sure things have not changed too much from Nair. In the super specialization, it was a perfunctory thing. Refer this patient to the dietitian for Ryle's tube feeds or something like that. Ye kar do, jejunal feed chalu karne bol do, that type of thing. There was nothing very seriously taken except, next, when someone like this joined the department, suddenly references would go up. And the whole gastro department would walk in and say, "Humko seekhna hai diet ke baare mein, what lovely foods you have here." Next. Ladies and gentlemen, this is how I looked about 30 years ago, and this is how I look now. You can see I've hardly changed, And this is what I was eating then, and I was this young, handsome bloke, and this you can see what has happened now. Next. So this is the type of food really we expect will give us the best medical conditions, the best health overall. Next. This is the type of food which is eaten by a lot of people, and we have enough data now to show that it leads to diseases in many, many different systems. Next. And to back that up, we have some of our very famous personalities, who are plant-based and are vegetarian. Some of them are vegan, but they are not predominantly non-vegetarian. That is all I can say at the moment. Most of them. But some of them very strongly. For example, Novak Djokovic, number 1 on tennis, Martina Navratilova, very strongly plant-based. So these are people who have access to the best medical advice in the world. Why would they suddenly turn to this unless there was science backing it? So I'm sure that when we go away from our natural diet, we are missing the bus. And the top flavor of the season, self-confessed plant-based person, vegetarian to the core, Next. And who is the world's strongest man, ladies and gentlemen? You can see that he comes from Germany. This man is a vegetarian, Patrick Babumia. I'm surprised at the choice of names. There is a Christian name, there is a Hindu name, and there is a Muslim name all together. But that's what he is. And you can see the strength. So the whole thing which is in our head that a vegetarian is a thin, lean, scrawny guy, prone to tuberculosis, prone to deficiencies, is laid to rest. I have myself turned vegetarian since the last 9 years. And from the last 3 years, with Dr. Rupa Ben's constant prodding, I'm totally plant-based. And I can tell you that a lot of my problems have come to an end. Of course, this happened because I sat in a drunk auto rickshaws guy and who jumped me over a speed breaker 15 days ago, and I'm still, abhi tak uska paschatap chal raha hai. I could not go to Kumbh, maybe that is why. Next. And which is the other elephant in the room, the branded packaged foods. What I call food porn. We see this, you walk into any mall and you'll see all this. Next. The burning and the processing of foods inhibits mitochondria. Converting foods with high protein and sugar, which most processed foods are, produces something called a Maillard reaction. The Maillard reaction leads to a proliferation of what are called AGEs, advanced glycation end products. And the advanced glycation end products lead to advanced aging or premature aging. So it's very easy to remember aging and AGEs. So your premature cataracts, your wrinkling, your arthritis and other things are often due to this combination. And you know that only a high protein food coupled with a carbohydrate, which is such a common thing. You walk into any mall and you'll get that type of food. Next. And these are a collage of recent articles. Ultra-processed foods leads to fatty liver, ultra-processed foods leads to dementia, premature deaths, depression. And processed foods is an experiment that has failed, and this is from Robert Lustig, one of my heroes, whose book, Metabolical, is really a great eye-opener. Next. And you can see that this man sings, "I'm still thirsty, maybe I've got a leaky gut." And what is this? Next. So a whole lot of substances disrupt what are called the tight junctions between the enterocytes. And these junctions are maintained by what is called the zonula occludens, which is a protein which binds the enterocytes tightly. The moment you get substances like fructose, which you get from high fructose corn syrup and so many others, juices and all that which we drink, this disrupts the barrier. Next. And next. And once this barrier is disrupted, the bacteria walk in and you get problems. You get a constant state of inflammation coming on, because bacteria walking into your bloodstream leads to cytokine release and a whole lot of inflammatory mediators, which then cause systemic problems. One of the organisms called Firmicutes prosnitzi is also known to produce all these problems. So it saves you, but if you don't have proper mucus and you don't have proper Faecalibacterium prosnitzi, then you will tend to get a lot of these leaky gut syndromes. Next. Gut microbiome in patients with obesity is again next. Very well known. So these are tongue twister names, Akkermansia, Faecalibacterium, and if you have these, you will have lean associated genera. Right. Next. So we know that ultra-processed foods lead to obesity and weight gain. Next. This is the connection between the gut and the brain. Next. And you know that the vagus nerve is important. Gut-brain axis we've already alluded to. Next. And short-chain fatty acids are the ones which, so the vagus nerves acts as a highway between the gut and the brain and leads to two-way communication. So a problem within the gut which produces less serotonin leads to depression. 95% of the serotonin is produced in the gut. Next. We've discussed this. Next. And we know that inflammation in the brain can lead to chronic fatigue syndrome. Next. Regular naps prevent old age, especially if you take them while driving. Next. And our air, water from Scientific American are increasingly, there is an increased number of scientists which are convinced that these contaminants lead to a whole lot of disorders, endometriosis, diabetes, autism, etc. Next. Of the food and water for drinking water for 40 million Americans was found to contain antibiotics, mood stabilizers, and sex hormones. Are we surprised that Donald Trump gets elected every now and then? Okay. Next. And a man who is known for his multiple talents. One of the talents is on display there, and he's known for certain things which are epic. His statement like, you live in a country where you can piss in public but can't kiss in public. Okay, next. So you take, 1 minute. You take this diet, next, pass it through the colon, and you get this, okay? In 1800, according to one of the Tharoor-isms, India controlled 34% of the world GDP. In 1947, when the British left, we were 1.34%. No wonder the British were called colonizers. Wherever the colon is, it converts good things into, you know what, next. Not even tigers eat flesh 3 times a day. Next. You lather your colon with meat thrice a day, you're asking for trouble. There's intimate connection between red meat and colon cancer. And the biggest animals are vegetarians. Next. Okay. The SAD, the standard American diet, also called SAD, increases obesity by impacting microbial diversity. Next. Right, we know that I discussed this, the large number of colon, which the microbes in the colon. And why were those vegetarian animals not having diabetes? Why don't they get B12 deficiency? Why don't they get so many things which you and I get? Because for their dessert, next, they do this, okay, which is called coprophagy, which is eating your own feces, okay. They don't go and eat gulab jamun, jalebi, fafda, okay? Coprophagy. And what have we done? We have created a bombastic word called fecal microbiota transplantation. And what have we done? The same thing. Okay? We've changed the whole colon, rebooted it. It's like eating your own feces. And you can cure bad pseudomembranous colitis, bad alcoholic hepatitis, alleviate inflammatory bowel disease, alleviate IBS by using all this. So this is hardcore science behind it. Next. We are not carnivores. You look at our canines. Next. We are starchivores according to a big authority. Next. 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 And Time magazine put this as in 2004, that the secret killer is inflammation. And inflammation is produced by alteration of the gut microbe. There's hardly any doubt on that. Next. These are the diseases you can cure by going on to a whole food plant-based diet. Next. Eat food as it is, not like this. Next. These are the certain things which authorities have said. Next. Go back. Something went wrong. As we moved from our Homo erectus to the Homo sapiens, certainly things have gone wrong, and going back to this possibly only as far as diet is concerned is important. Next. You try, this is a very famous slide, you try to tell your patient to do plant-based, you try to tell him to do exercise, okay, get up in the morning at 5, sleep at 10, and he quickly shifts to the next clinic which offers him all this. Okay? So be careful on how you tell that. Next. Hippocrates said all diseases begin in the gut, we know that now. Next. And this is food for thought. That's my last slide. You can take a picture of this. Thank you very much. I'm sorry for exceeding my time, Dr. Sharang, by a few minutes. Yes, there is a company which is coming out very soon that the trials are on. I don't promote names, so I don't talk of. I'm not sure, sir. The trials are still on, but they in Europe, especially in Netherlands, they've done a lot of work. The company is from there. That's good news for me, sir. I'll have to go and read that. About? Yes, somehow this is, you know, certain things are causal and they may not be definitely etiological, but this is a known causality, what do you say? Not causality, it's a known association which has been found that homes which have more pets somehow have lesser incidences of allergy. Of course, you can get allergic to the pet also, but that's not so common. Yeah. I can't hear you, sir. Little louder. Yes. I'll have to look up the data on that. I'm not sure.
I'll just point out one thing, that we have worked with some ADHD kids, and the GFCF diet not only works for the ADHD kids, but also the autistic kids. So why to start with the FMT and not work on the gluten-free and casein-free diet first? I personally have experience of 3 children.
I thought you were a dermatologist.
Okay.
Whether which diet? If someone is having a very acute exacerbation, he's passing, 5 to 10 stools a day, he's bleeding, obviously you'll go on to a slow residue diet. But later on, I'm sure if you chew it well, why not? Dr. Shobna, do we have any data on that? No. Yeah. But it's certainly a much more healthier form. Of course, it can't be only that. There has to be a balance.
Now may I call upon Dr. Kumta, and thank you, sir, for the topic most awaited. And now that I think you all have digested your lunch well, after sir's presentation, we'll have some movement again.
Good afternoon, everyone. Have you ever had a patient in your practice that completely changed your concept of a disease and its management? So let me tell you about one of my patients. This is a 58-year-old patient who was type 2 diabetic since 20 years. I was treating him for diabetic retinopathy, and he was on orals as well as insulin. He had come to me with loss of vision in both the eyes. This was the OCT scan showing macular edema. And over the last 3-4 years, he had gained 30 to 40 kilos of weight due to increased insulin dosage. So I sarcastically commented that he had put on so much weight that only bariatric surgery would help him. And I saw him a month later, and he had actually undergone bariatric surgery. The patient had lost 20 kilos of weight in 1 month, and within a month he became nearly non-diabetic. The diabetic macular edema also remarkably reversed in a matter of a month, and it remained reversed for many years after that. Normally we would treat such patients with multiple doses of intravitreal injections. Overall he lost about 60 kilos of weight. Another patient who was a young 39-year-old type 2 diabetic on 82 units of insulin, lost 25 kilos on a plant-based diet, whom I had referred him to a plant-based nutritionist. And all his insulin was stopped, and the HbA1c, which was 13 on 82 units of insulin, went to 6.4. So a few thoughts. So both patients reversed their type 2 diabetes. Bariatric surgery did not cure the first patient of diabetes, but weight loss did. And weight loss could have easily been achieved on a whole food plant-based diet as the second case. Were long-term diabetic medications truly necessary, or did they contribute to further weight gain, ultimately worsening diabetes in both the patients? Should lifestyle changes have been the first approach? And diabetic macular edema was reversed by reversal of diabetes, not pharmacological control of blood sugars. There are many retinal surgeons and ophthalmologists here, and we all know that the more insulin you put the patient on, the worse the diabetic macular edema gets. So why should a vitreoretinal surgeon be interested in diabetes reversal? That's because of a very strong family history of diabetes, witnessing patients getting worse in spite of increasing medications and insulin, and disillusionment with the current treatment of chronic disease. And I'm sure most of you are disillusioned. That's why you all are here. So these are our heroes that I have followed. Whatever I have gained in knowledge is from these heroes or rock stars of lifestyle medicine who reverse coronary artery disease, serious disease like multiple sclerosis and lupus only on a whole food plant-based diet. So there are a few ills of modern medicine. It is right now reductionistic, single causes, single biomarkers, single diseases, and it encourages development of drugs with side effects. For example, we are focusing on things like blood sugar, cholesterol, and we are like 6 blind men and the elephant without seeing the whole picture. When a patient comes with diabetes, the doctor typically tells him, you've been detected with type 2 diabetes. Can I get rid of it, doctor? Type 2 diabetes is incurable. It runs in the family, hence it's not preventable. Meds will keep on increasing with time, and eventually it will require increasing doses of insulin. The tighter your control of diabetes, the better will be your outcome. You should decrease your carbohydrates to control diabetes. And we are treating the symptom, not the cause. Let's see all these in detail. So the first thing is, so the first myth we need to examine is, do we maximize medications to normalize blood sugar levels? And there are a lot of hidden barriers which force doctors to follow conventional guidelines for managing type 2 diabetes. Patient prescription bias, lack of nutrition knowledge, medical standards of care, influence of medical bodies, and reluctance to de-prescribe. So there are also conflicting medical guidelines. You can see that the acceptable HbA1c by different organizations is different, and these are going to become tighter and tighter so as to make diabetic control more and more difficult, and the usage of more and more drugs possible. So diabetes medications, are they healing or harming? So there's a downward trend with every most diabetic medications. They make you gain more weight, and you become more diabetic as a result of gaining more weight, which leads to more medications. And we know about insulin causing weight gain. So you must understand that the pharmaceutical industry does not create cures, it creates customers. So every new drug is not actually meant for patient welfare. So let's look at the gold standard drug, that's metformin, that causes a 31% increase in all-cause mortality. Sulfonylureas can cause 2.5 times increased cardiovascular mortality rate. Even the ACCORD trial, which was meant to find out whether intensive strategy of controlling diabetes is good or no, and it led to 22% higher all-cause mortality and had to be stopped prematurely. So the myth is that diabetes drugs are mostly free of side effects, and the fact is that they actually have a lot of side effects. The second myth is that the tighter your diabetic control, the better will be your outcome. And actually the fact is that intensive control can lead to adverse side effects. So let's examine the cause of diabetes, especially type 2 diabetes. Now this is type 1 diabetes, we are all aware of. It's due to insulin deficiency, due to killing off of the beta cells of pancreas. Now there's only one thing I wanted to mention about the dairy connection with type 1 diabetes. Type 1 diabetes often happens because of a leaky gut causing in childhood, caused by cow's milk allergy, which leads to some proteins, milk proteins entering the bloodstream. And the body mounts an immune response to the milk proteins. And because the proteins on the beta cells are very similar, the autoantibodies will attack the beta cells and kill them off. And this has actually been published as well. Yet I think that very few diabetologists are aware of this, and they still prescribe dairy to type 1 diabetics. So let's come to type 2 diabetes. Another myth is that carbs are the cause of type 2 diabetes. We'll examine some studies with carbs. I'll skip this. This is just to tell you that all carbs are not the same, and we've already gone over this. So you have simple carbs which are to be avoided, and of course processed carbs. Now let's examine whether a low carb diet is helpful. Nowadays we have a lot of physicians who are prescribing a low carb diet for diabetes. Low carb diets do, like Atkins and a keto diet, do cause rapid weight loss and improve glucose levels in the short run. But they may treat the symptoms of the disease while actively worsening the disease. Your blood sugars are going to be better on a low carb diet because you're not giving a carbohydrate challenge. But the moment you give a carbohydrate challenge, the blood glucose is going to go through the roof. And it's also associated with many other conditions such as fatty liver, systemic glucose intolerance, and many other problems. So this was published in the European Society of Cardiology, which said that there was an increase in all-cause mortality on the patients who had the lowest carbohydrate intake. So let's explore the real but hidden culprit of type 2 diabetes. And by definition, type 2 diabetes is caused by insulin resistance. That means insulin production is normal or is high, but the insulin is not working. Now let's see why that happens. Now this is a typical muscle cell. These are the glucose molecules trying to get inside the cell. These are the insulin molecules, and these are the receptors here. So what happens is when glucose enters the bloodstream, the insulin is released and it attaches to the receptor, and that opens up pathways and allows the glucose inside the cell. So what happens in type 2 diabetes is that the insulin is there, there's a lot of insulin, there's glucose here, but the insulin binds to the receptor, but something interferes with the intracellular signaling and prevents the opening of these channels. And what is that intracellular, what is that thing which causes this? And that is intramyocellular lipid. This is called as lipotoxicity, and it's a major factor in insulin resistance. That means collection of fat inside muscle and liver cells and eventually pancreatic cells, causing lipotoxicity. So diets rich in saturated fats derived from meat, milk and vegetable oil are the main cause of lipotoxicity. And this has been approved by techniques such as NMR spectroscopy. And there are several other studies which have proved that lipotoxicity is the main cause of insulin resistance. So this was a very nice study which was published in 1927. There was this Dr. Sweeney who took 9 medical students, healthy medical students, and first he put them on for 2 days on a rich carb diet. And you can just see what all things they ate in the rich carb diet. And then he did a glucose tolerance test, and the glucose tolerance test was normal. Next, he put them on a high fat diet with a lot of butter, olive oil, egg yolk and all that. And all of them tested diabetic. These are healthy medical students. So that proves that fat is the cause of type 2 diabetes and insulin resistance. So what should be the ideal management? Of course, we should always do no harm. We should inform the patient of the consequences of the treatment and let the patient make a choice. We should at least tell them that type 2 diabetes is reversible and not put them on pills immediately. We should inform them about the side effects as well. So diet, whole food, plant-based is what we recommend. And this is how your plate should look. So this has already been covered. Now these are the 4 things that we already mentioned lipotoxicity, but there are 3 other factors: inflammation, oxidative stress and dysbiosis, which are also drivers of insulin resistance. Now plant-based, we already talked about lipotoxicity. Plant-based eaters have the lowest rate of obesity and hence the lowest intramyocellular lipids, which are markers of lipotoxicity. Now inflammatory foods are all your meats and dairy, and all your processed foods are inflammatory. And those who eat plant-based have the lowest levels of CRP, as shown in many studies. Next is oxidative stress. Now we know that oxidative stress is at the basis of most diseases and chronic disease as well as aging. And this is demonstrated by the apple experiment. If you cut an apple and you sprinkle lemon juice on one side, that does not get oxidized, and that prevents oxidative damage. And when you eat these foods with multiple colorful fruits and vegetables with all kinds of phytonutrients, vitamins and antioxidants, you are doing the same thing to your tissues. And dysbiosis has already been covered. So the advantages of whole food plant-based diet are that it has high water content, anti-inflammatory, very low, very high antioxidants, very high fiber, and calorically dilute. And of course it has a lot of fiber, which is the missing element in most foods. Now it's very, very important to stop oil if you want to reverse diabetes, because only by stopping oil and dairy can you achieve the low level of 10 to 15% of total calories from fat in order to reverse type 2 diabetes, which is caused by insulin resistance. Okay, let's look at a few studies on reversal of type 2 diabetes with a whole food plant-based diet. This was a study done by Dr. James Anderson, where he put patients on a plant-based diet with high carbohydrate and high fiber, which means whole natural foods. And what he did is he took 20 lean men receiving insulin therapy, and they received a controlled diet for 7 days, followed by this diet for the next 16 days. So the same patient served as his own control. So these are 20 patients. So you can see here that within a matter of 2 weeks, the insulin dosages came from 15 to 0, 15 to 0. These are 20 patients. And you can see sometimes the duration of diabetes, for example, in this patient was 20 years. And within 13 days, he was down to 0. So also there was a very dramatic reversal, decrease in serum cholesterol. You can see that on a high carbohydrate, high fiber diet. Another study done by Dr. Joel Furman using 13 type 2 diabetic patients showed a dramatic decrease in HbA1c from 8.2 to 5.8, and the medications were reduced from 4 to 1. Dr. Neil Barnard, who has been reversing diabetes patients since 30 years, showed that 71% of patients could stop their oral meds in a 26-day program. Also, Dr. Pramod Tripathi in India has published a lot of data and has reversed, I think, 10,000 patients with type 2 diabetes. So exercise has already been covered. Now in this, I would just like to say that most of us talk only about cardio, but it's very, very important to note that resistance training and strength training is very, very important. And climbing stairs, stair climbing is a very good exercise for type 2 diabetics. Now, cells become more insulin sensitive. It removes glucose from the blood using a mechanism totally different from insulin. And it also causes weight loss and increase in muscle mass. Now, body composition is very important. Now, the direct trial showed that if you lose 0 to 5, up to 5 kilos of weight, you can have a remission rate of 7% in type 2 diabetes. If you lose 5 to 10 kilos of weight, 34%, 10 to 15 kilos of weight, 57%, and more than 15 kilos of weight, 86%. Now, how many type 2 diabetics you know have are carrying at least 15 to 20 kilos of weight in excess, and yet they are put on insulin and increasing doses of insulin. So what they need is just weight loss to reverse their type 2 diabetes. So even a small amount of weight loss can dramatically improve insulin sensitivity. Now these two patients have the same weight, but the body composition is very different. One has a lot of fat and no muscle, and the other one has a lot of muscle mass. So we have the skinny fat patients. We have a lot of type 2 diabetic patients who are skinny fat. They have a lot of fat and almost no muscle and a lot of sarcopenia. So they should indulge in strength training to build up their muscle mass. Stress management again is important. Optimize sleep, socialize. We should supplement vitamin D3 and vitamin B12, that's very important. This is how the ideal prescription pad should look, not 10 or 15 medications. So what I recommend is to have a green smoothie as a breakfast in the morning. And a cool thing about a green smoothie is that a recent study has shown that even three weeks on a green smoothie can lower your CRP levels by 40%. And it's an ideal breakfast. Then you can have lunch and dinner, so you can have 3 meals, and each time there should be 50% raw. So you start with a salad, and then you eat cooked food, and preferably make it equal quantities. So in a nutshell, type 2 diabetes can be reversed if you lose 5 to 20% of your body weight, lose fat, increase muscle mass, eat whole, minimally processed plant-based food, avoid processed food, no oil, meat, and dairy. And these are Indian doctors who've been reversing diabetes since many years. And these are doctors I would really recommend you to check out on YouTube and their websites as well. And now there are many health influencers and non-medicos who are actually treating diabetes, and they get much better results than most diabetologists and endocrinologists. And unfortunately, physicians are losing out to these people. So it's time that we clean up our act and we get into a reversal of chronic disease instead of these. I would strongly recommend these books, and I would advise all of you to go to nutritionfacts.org for more information on nutrition. Thank you.
Thank you so much, Dr. Kumta, for the insightful session. I think a lot of questions have been answered, and it's good if you have more questions, because at least that will start making us think, read, research. May I now call upon Dr. Himani Tandon. She's a musculoskeletal physiotherapist for all of us, because as we promised, as lifestyle medicine practitioners ourselves, we cannot sit for so long, right? So let us, as Dr. Kumta said, strength training. You know, it's not only the cardio. Let's see how much strength our muscles have. Over to you.
Good afternoon, everyone. It's lovely being here with all of you all, and the entire audience is so active, so I think it'll be nice to have some few exercises here. The whole topic that I'm going to be talking about is back and neck issues that I think as doctors also we have, and obviously our patients. The most common thing that I think as a musculoskeletal physiotherapist that I encounter is the cervical issue, the mid-back issue, and the lower back issues. The treatment that I follow generally is a McKenzie method, which works fantastic. This man, Robin McKenzie, in his late 1950s, was totally not accepted because he was an extension biased protocol that he came across and he put forward. People didn't like it because everyone was about flexion-based exercise protocol. And he changed it, he showed results, and fantastic results came after that. And I think in 1987, he actually was world over, and the therapy now that we follow for back, neck issues is the McKenzie protocol. Works fantastic. So I'm going to have like a 5-5-5 protocol, that is 5 exercises, 5 times a day, 5 repetitions each. Simple. I think we all can do it. I think as practitioners, we can definitely take out 5 minutes in the entire day, 5 minutes 5 times a day, but then that can really make sure that you all don't land up with any back and neck issues, plus you can really help your patients too. So, should we do that? Yeah, I mean, everyone's like up for it? It'll be nice if at all I have a volunteer. No, I think I'll demonstrate a volunteer. Can anyone come as a volunteer? Oh, thank you, Dr. Anuja. Okay, so let's start with the cervical. You all can be all seated. The first exercise would be, I just want you to take your neck straight into retraction. Yes. You all can possibly do it at the same time. Just take your neck straight behind, as if this is your car and your car is going in reverse direction with all 4 wheels on the ground. Yeah, super. Simple, easy, and very effective, because all the time what we are doing is protracted. You're writing, you're on the laptop. It's all about forward, you're operating. Everything is all about forward neck. Simple exercise, easy to do. No, so just go into retraction and come into neutral. Go into retraction, so maybe you can face this side and do it, yeah. Go into retraction, come into neutral. Simple exercise. Second one, very simple again. Just take your hands up, both, and stretch it up. Take it up together. Imagine someone's pulling you up. This is like a self-traction that you can give to yourself while you are actually in your clinic, and you can prescribe your patients. Very simple. Imagine someone's like really pulling you hard. You could do the same exercise in standing as well, while you imagine that someone's pulling you down on the floor with a little shoulder width apart. Yeah, and imagine someone's pulling you down at the same time, someone's pulling you up. Your entire spine gets stretched and you get really very nice stretch of the vertebrae. Third exercise, fantastic exercise that I think all of us should do, is putting the hands behind like this and just go. You all can possibly stand for this, and trust me, you all will love this exercise. Yeah, and just go behind. Just go behind as much as you all can. Yeah. I'm sure after like a lunch break and like completely sitting, this is like a must exercise that you all would like to do. Just go behind as much as you can. 5 repetitions, more than enough, but this is going to make sure that there is no build-up of stress on the lower back. Excellent exercise. Fourth one, no, a little bit stomach might just come out. Just make sure that you're not bending so much your knees. That's it. Just go back as much as you can. It's fantastic exercise. Now, 2 exercises are there which I demonstrated with a stick, but it's okay if you all don't have the stick as well. This is very good for posture control. Plus, in the early days for shoulder, everyone spoke about shoulder ladder, taking the hand, walk on the wall. But on the contrary, if you want your shoulders to be better, shoulder extension works excellent. So take your stick behind, yeah, and just take it as much as you can. Perfect. I would have loved to get for all, but I have one, but you all can actually clasp your hands together and maybe take it behind. No, clasp them together. Clasp your hands together and take it behind again. Yeah. Yeah, hands together, take it as much as you can. Fantastic exercise, a very good posture control exercise as well. And the last, very beautiful, most effective exercise that I have found is, again, with the stick, you can hold it. Okay, you can possibly turn around. Scapula, you can retract, you can get it together and depress it. Yeah, so into scapular retraction, and now depression of the scapula. Excellent. Why? Because we are out here like this, and this is exactly opposite, and which actually makes sure that your posture, which is into slouching, gets corrected very beautifully. Yeah. resistance band would be to do the exercise. This is a stretch. So, no, but then you won't get a stretch with it. For that, you will have to stretch it out. You can hold it. So you retract the scapulas, get the scapular borders towards each other, and then get your hand into depression, the scapula into depression. So actually, you know, Dr. Anuja, you can put it here. Yeah. Don't fire your trapezius, just get this and slightly depress. When you slightly depress, you would get a beautiful stretch here. And trust me, this works like magic for the upper back. People have a lot of upper back pain while you are like writing, trapezius pain. They really go pretty good with this. They really get very well managed with this exercise. 5-5-5 works superb. You can possibly do this. Thank you so much.
Thanks a lot, Dr. Himani. I just noted down all those ones because our postures while seeing the patients can be so bad, and by the end of the day we have neck pains, and that's like any age group can get it. Let me call upon Dr. Rupa ma'am, who will talk more about dairy.
Hello, can you all hear me? Everyone? Charged up? Exercise, a lot of advice on stress, diet. So far, what have you concluded for the day? What have you learnt in one line? Plant-based diet. You'll go home and you look into your kitchen, you look into your plate, and you'll start thinking about it, right? Is it plant-based or not? Do I do it or not? What is left? Where is the mistake? What do I need to change now? I hope the message is clear so far for everybody. Is it? Yeah. It is happening all over the world. We are a little bit lagging behind in the plant-based movement. In US, there are conferences where big conferences happening where about 500 doctors meet every year discussing on plant-based diet already. So we are still like lagging behind. We are not that big here in India, but we will get there very soon. And what is roti, sabji, dal, chawal? Yeah, it's plant-based. And we have the largest vegetarian population in the world, correct? And so we can become plant-based quite easily because we have huge variety of possibilities, right? We will not be suddenly lost for kya khao or something, because a lot of our food is already plant-based. But there's just one, like we say we are vegetarian. I was also one of them. I'm a vegetarian, but I'm a lacto-vegetarian. I was a lacto-vegetarian. That's not true vegetarian, right? Lacto-vegetarian or lacto-ovo or Presco, all those are not vegetarian. Real vegetarian is plant-based. Of course, they call it as vegan. So dairy is not vegetarian. Dairy is animal food. You all agree? Yeah, but it's not vegetarian. It has green dot on all the foods that have dairy in it, has a green dot, but it's not vegetarian. So what did I discover over the years about dairy products? That I want to share very quickly as fast as possible, because Sharang is constantly looking at time and me. Recently, I think some doctor's interview came in the newspaper, Times of India story, saying that dairy is not vegetarian. It's actually non-vegetarian. But there's argument saying that in taking the milk of a cow, you're not killing the cow, right? So you think it's not non-veg, it's vegetarian. But that's not the way it is. So here's the question. This is for the prize alert. What is in the glass of milk? Somebody wants to answer? What is in the glass of milk? Oh, somebody's saying pus. Have you heard it? What he's saying? He's saying there's pus cells and hormones, antibiotics, oxytocin, and what else? Detergent. Oh my goodness. But a proper cow milk may not have detergent, no? Correct, no? It may still have? Urea. Oh, what else? Bacteria, yes. What else? What is in the glass of milk? It is cow's food, of course. Every mammal makes milk for its young ones, not for us. Okay, I think you all are very, I thought I was expecting an answer, but everybody answered, so we can't. Kya batao? IGF, yes, yes. So I thought you were going to answer me like this, इसमें protein है. I thought so. यही तो सिखाया है ना, स्कूल के टेक्स्ट बुक में ये तो है सब. So मुझे लगा आप लोग बताएंगे मुझे, ये है, वो है. तो ना, but don't we run after small child? बेटा दूध पी ले, प्रोटीन मिलेगा कहाँ से, तू बड़ा कैसे होगा? Don't we do this at home? हाँ, grandma runs around, 1 घंटा उसके पीछे 2 ग्लास दूध रोज पीना टाइप. नहीं तो कैल्शियम कहाँ से मिलेगा? You all agree with me or not? This is the existing concept, no? I agree. I no blame to anybody. We are the most milk-loving country in the world. You cannot take dairy out of an Indian's heart or mind or stomach. Okay, this is the picture. What is in the glass of milk? Some of you already answered. I'll just say very quickly. Dioxins, have you heard about it? Dioxins, pesticides, yes? Hormones, there are female hormones, growth hormones, antibiotics, pus cells, blood, some bacteria, and finally the milk protein casein. All this is in the glass of milk. Did you think about it when you drink a glass of milk which is on your table, or an ice cream, or a rasgulla, or a gulab jambu? So quickly, this is a WHO website that says that dioxins are the environment pollutant. And the concentration of dioxin is very high in dairy products. So it is automatically going into your stomach. And that is going to cause a lot of problems. Pesticides, the last line I want to read. And in India, milk and other dairy products like cheese and butter have been reported as the major sources of dietary DDT. So these are pesticides. Recently, some YouTube channel is tasting the butters and all of a very famous company and could not pass the taste because there were pesticides in it. Then this, have you heard of it? Yeah, there is adulteration of milk because milk is very pricey. So anything that is pricey, उसमें कुछ न कुछ parallel industry गड़बड़ होना ही है. This was, I wanted you to know that this is in the artificial milk, very cheaply available at 30 or 40 rupees. There is no cow or buffalo, there is some factory, and these are the possible ingredients of it and can make up a fake milk. So you don't know whether you are eating it, the real milk or all this stuff. Now A2 and A1, have you heard about these words? A2 cow. So many people are switching over to A2 deshi cow and organic and grass fed, ये सब है ना बताया है. So there is some issue with the A1 and A2. So A1 is, now we have Jersey cows. So there is a difference in one amino acid, and because of that, the problems might be more probably because of A1 rather than A2. The study is still going on. Research data is not yet complete. So I'll just quickly mention there's one histidine in A1, and it is related to a lot of health issues. But that still doesn't mean that you are going to take A2 cow milk because of all those things that I already told you, right? The list of things that we already mentioned before, the dioxins and other things, they are already there. So you are still not going to have either A1 or A2. These are the listed ones with the A1. Research data is available on this. Okay, what are the diseases which are actually now linked with dairy products, and we have the research data already available. So saturated fat. So milk has a lot of saturated fat, and this is already directly linked with heart disease and also diabetes. It also contains cholesterol. So the website that I have written here is pcrm.org. This is taken from there. And that is Dr. Neil Bernard's website that has a lot of research data. And finally, they are saying that how saturated fat in the dairy is linked to so many diseases, including the last line, the breast, prostate, ovarian cancers. So, the full fat dairy if you get, then there is a lot of saturated fat there. There is ghee, there is butter. All of these have higher amount of saturated fat. And so if you are going to have this in a generous amount, then just wait and watch. You should have those diseases that I already mentioned. Then type 2 diabetes. Dr. Kumta already mentioned about the lipotoxicity. So saturated fat in the milk is directly related to the lipotoxicity, increasing your insulin resistance, therefore type 2 diabetes. So what we observe, that I have many patients who are diabetic, they are lacto-vegetarian. The only thing that you tell them to do is to give up dairy products. The amount of saturated fat entering the system reduces drastically, and within weeks you can see they reverse their diabetes. Isn't it surprising? Within weeks, and they come and tell me that I have been taking medicines for 9 years, 10 years. No doctor told me to do this one step of stopping the dairy products. Once I stopped the dairy products, within weeks, my medication stopped. So this is the role of that saturated fat in type 2 diabetes. Type 1 diabetes, as sir already mentioned, if the exposure to cow milk in the first year of life, right? As soon as the weaning starts, the mother starts looking for milk. Abhi kaun sa doodh do, kaun sa acha rahega, organic, cow. And then if you expose the child earlier to cow's milk, proteins, then later in life, the chances of developing type 1 diabetes are higher. The study is already available. Then, of course, cancer link. There are two things in the milk, the high hormones and the protein in the milk. So quickly I will go over. Already the link is found with prostate and breast cancer. Just think about it, that this animal, cow or buffalo, has to be pregnant. You understood? No cow just gives milk like that, right? Just because she's a cow, right? She has to be a mom. She has to become pregnant. In our country, they are artificially inseminated. 9 months of pregnancy, she delivers a baby, a male calf or a female calf, then she starts giving milk to her child, right? Her calf. And little bit of it is given to the calf, the rest is taken for the industry to sell. This is how the milk comes. But they are also now further designed in such a way that within 2 or 3 months, the second artificial insemination happens. Now she's feeding her calf and she's pregnant at the same time. She's lactating and she's pregnant. You understood? The milk that comes in your home, do you know from whom it comes from? Is she pregnant as well? In the pregnancy, the estrogens are 20 times higher. The milk that comes in your home has 20 times estrogen if it's from the pregnant mom. But do you know from which mom it has come? Or do you know like which buffalo, 2 months, or whether she was pregnant, and the mixture of all that? Yeah, you have no clue about the amount of hormones that are there in your milk. So casein now, the casein is the milk protein, the other one is whey. So protein, the casein has this, Dr. Sharang already mentioned about it, this mTOR pathway. So this is related to cancer like prostate and breast cancer. So the reason, because casein is a protein that may stimulate the growth of cancer cells. The China study, the book that was shown again in the previous talks, the same book also has this study that talks about higher is the consumption of casein, it is increasing the chances of liver cancer. So one more, and it might be because of this insulin-like growth factor 1, which is a hormone that is found in the milk. Why? Because a calf, a calf is like 30 or 40 kilo at birth and has to become 150 to 200 kilo in just 1.5 years. Whereas human baby is just 3 kilo average at birth and becomes 9 kilo in the first year of life, like 9 or 10, and after that the growth is very slow. So here the growth factor is very high because the calf has to grow up and become adult very quickly in a very short span. So it's very high quantity. It's allowing the growth of the cells. So this is the book, and here Dr. Colin Campbell clearly mentions that casein is actually a carcinogen. Again, the casein consumption has been linked with increased levels of IGF. So again, these two are totally linked. There is a protein, there is a hormone. And again, now there is a link with the prostate and the breast cancer. Do you wonder that now we have so many breast cancer patients increasing in number, even in India? I think it is because of increase in the dairy consumption. Because I think when I was a child, there was a rationing of milk. We did not have so much of milk or milk products or 50 kinds of cheese, none of those. We didn't have these things available. But now our refrigerators are full of all kinds of dairy products, sweets. We eat it round the year, we eat a lot of these. Then also one more study that has found the link with ovarian cancer. And some animal studies are also done and clearly proving that there is increased possibility of cancer if you have more dairy, casein particularly. Then there are, as I mentioned, natural hormones in dairy, estrogen and progesterone, which are inside, and these can influence the hormone-sensitive cancers. Then this is the second one that I mentioned, insulin-like growth factor is going to be one more cancer, colorectal cancer. So when a lacto-vegetarian gets cancer, I always suspect the dairy link. It's a colorectal cancer. Then in the Western countries, they are giving some hormones to animals also. These are artificial hormones just to increase the milk production. So that is again having some link with IGF-1, and then this may promote the cancer cells. And so we have more cancer cases in the countries where these are injected. Then lactose intolerance, I don't have to tell more about it. Already all these are the symptoms because see, we do not have the enzyme to digest milk, which is called as lactase. And so that's going to be a problem. If we can't digest milk, then how should we take it? We shouldn't be taking it. And the data says that about 60 to 80% of the population is already lactose intolerance, but is not knowing about it. One of the popular disease, IBS, improves dramatically when you give up dairy products. And these are the just various symptoms that one can expect, and then diagnose that might be a lactose intolerance. I tell people to give up dairy products for 30 days and observe for themselves. If these symptoms improve, then that means they can't digest dairy. The best is to give it up. Then the calcium wala problem, because after all the lecture and everything, people still get up and say, but mere calcium ke liye to chahiye na, right? मेरे डॉक्टर ने बोला है 2 ग्लास दूध पियो, कैल्शियम की गोली खाओ, मेनोपॉज हो गया है. So obviously I know about it, that this is a question that will be asked, but there are big animals like elephant, horses, they don't take any calcium supplement, they don't drink milk of another species, they just eat grass, they are herbivore, and yet their calcium levels are maintained. Where is the calcium? Primarily in the plants, right? And thinking that I will get it from milk products is another way of looking at it. It's a second hand. Why not take it from the plants itself? There are some studies that says the high dairy intake does not necessarily reduce the fracture risk. And in case, sometimes it increases the fracture risk. Can you imagine? Totally different. So there is no benefit of drinking lots of milk and thinking that my calcium will improve. Then, as I mentioned, that plant-based sources are already very superior in calcium. Again, this British Medical Association study says the same thing. High risk of milk consumption was associated with an increased risk. It's quite opposite to our concept. This is what I am trying to emphasize today. One more. The reason that the dairy products, which are high in protein obviously, will likely to increase body's acid load, because you break down the acids, protein into acids, and the acidosis will need neutralization, and then the calcium from the bone will be taken to neutralize the acid. This is one of the way of explaining, and this process may weaken the bones. So the problem is this, that you consume dairy a lot and you get osteoporosis instead of having stronger bones because of the acid load. So there are some other studies also where they did excretion of calcium from the body, in the urine, and then they found that instead of gaining in calcium, you were losing more calcium. And so potential reasons of increased risk: high protein content because of dairy, then lactose intolerance, and there is also hormonal factors. Like they say that IGF may influence the bone metabolism. So these are the possible theories about it. Why we are losing calcium instead of gaining calcium when we take dairy products. These are just a very quick chart. Calcium kahan se milega? So calcium, you have lovely soy milk, tofu, broccoli, sarson ka sabji, methi, sesame seeds, figs, you just name it. All green leafy vegetables have calcium. You should be able to digest it very well and have your bones strong. There are many other factors for calcium, like vitamin D, exercise, not taking sodas. So those are extra points, but just to say that milk alone is not, we shouldn't be obsessed about milk for calcium. Then finally, some more links with the acne and other skin conditions, also because of the hormones and growth factors in the milk. I find that youngsters, if they are consuming too much of cheese, cheese has an addiction possibility. We call that casein into casomorphin, morphine-like effect. And that's how cheese does cause addiction. And if they give up cheese, then the acne also disappears, and often we observe PCOD also improves quite a lot. And then last one I wanted to speak about is the risk of inflammation. This casein also causes inflammation, and this may also have link with the autoimmune disorders. We already discussed about it, the hormones and antibiotics. These animals, the mastitis is very high. So some studies are now getting done. The level of mastitis in these farmed animals which are giving milk is very high, so they have to be routinely given antibiotics, routinely. And when a mother is pregnant or she is breastfeeding a baby, we don't give her antibiotics that often, right? Because the baby will get it. But here you are already getting a concoction of milk that already has all these antibiotics which are going in your stomach. You are exposed to it, and antibiotic resistance is going to be your problem. And of course, this is also known, cow milk protein allergy, CMPA it is called as. So there is a clear-cut allergy to milk. So they say, right from childhood, if some pediatrician has figured out that this is like milk allergy, if they stop it and then they take everything that is dairy-free, then they improve quite a lot. The casein and whey, these are the two proteins. And then these I don't have to mention. I'm sure all of you doctors here already know about all these diseases which are there because of dairy products. There are some more I have in the list, are this viral infection, parasitic, bacterial. These are also problems with dairy. Then there is environmental problem. The greenhouse emissions, water usage, all this. See, when you want 1 liter of milk, see how much of the water you are going to use is dairy milk, 1 liter. You can see how much, almost about 800 liter of water you use. The rice milk much lesser, soy milk very little water, oat milk very less, almond little higher. So also the greenhouse gas emissions are much higher with dairy, and the land that is used, because you're going to feed that animal, right? So you will use a lot of land. This is pretty, I would say, not so effective. You're using too many resources to finally get. And what is the real cost of milk? Are you getting milk at 80, 65, 70, 80 or 100 rupees, right? 100 rupees a liter. Is that the real cost of milk? Real cost is much higher. How does a farmer, dairy farmer, recover his cost? Oh, 100 rupees mein uska profit ho jata hai kya? You know what is his extra profit? Then finally he makes it. Do you know that? How the industry runs? It's that after 4 pregnancy, right? 4 pregnancy. 1 artificial insemination, 2nd, 3rd and 4th. She's about 7 years old by now, right? Now she cannot have any more babies. She's spent. She goes to the beef industry. India is the largest exporter of beef in the world. Do you know that? It was already announced in last budget. We are the largest producer of milk. We are the largest exporter. So dairy industry is hand in hand with the beef industry. That is how they make money. Then the ethical reasons I already mentioned. When the calf is male, the male calf is sent to beef industry because the male calf is of no use. Have you heard about this ever before? Do you know if a female calf is there? Obviously you are not going to send her to a slaughterhouse because she is going to be part of the production, right, line. So you'll feed her, you'll give her some milk. At 1.5 years, you will make her pregnant artificially. But the male calf, just after birth, you know that? Have you gone to some dairy farms? Every now and then you will see a van will come and pick up these very young babies. The mother has never fed, or maybe a little bit. And she's crying for her baby, but her baby is disappeared. And that milk we are taking. So those are the ethical reasons of like separating mother and calf and all other cruel practices that we have. This is a website called as nutritionfacts.org. Dr. Michael Greger. Look at the largest database in the world on plant-based diet. Every damn research paper that you want to know, go to this website, read. There's everything is there. He's written many books also. Fantastic analysis, lot of videos, and he doesn't talk without any research backup. He always talks properly about everything. Of course, he will mention about plant-based diet always because that's his purpose. Then we have this film. Have you seen this? Have you seen the poster? Anyone in the audience has seen this film? Rethink Milk? Okay, I made this milk. I made it. And please go on the YouTube and watch it. And beautiful interviews are there about this women and children and what's wrong with dairy industry. And one more that you should see, this is more on the ethical aspects, Maa Ka Doodh. It's already translated in many languages. This is also on YouTube. And then finally, these books were outside on display. I wrote them, the dairy alternatives, and what about my calcium. Dairy alternatives has wonderful, simple recipes you can make at home. Lots of recipes, YouTube videos, just, no problem at all, to find alternatives. So now the questions, who wrote the famous book, China Study? Somebody, hand raise, and someone who has not got the prize before and has remember. Your name, can you take it? Manali, the madam writer. Yeah, okay. Dr. T. Colin Campbell, who wrote this book about 20 years ago. At the end, after his career was over as a nutritionist, then he wrote the book because he wanted the truth to be out. The food industry and the government did not allow him to expose the data, but he did it once he finished his job. And then this book has brought about this entire whole food plant-based revolution. So this is, as a plant-based diet is more likely to produce good health and to reduce sharply the risk of heart problems, cancer, diabetes, osteoporosis, gallstones, and kidney diseases. Thank you very much.
Yeah, so the last talk of the day. When it comes to nutrition, there are certain things that we know, okay? There are a lot of things that we know that we don't know, but there is vast majority that we don't even know that we don't know, right? And that is the big problem. We look at these small things and we think that, oh, this is the whole world revolves around that calcium and around that and this and that. But as, again, in the China study, sir has said, that nutrition operates at an infinitely complex biochemical system involving thousands of chemicals and thousands of effects on our body, and isolating nutrients and trying to get benefits similar to whole foods is basically, it reveals our ignorance of how nutrition operates in the body. We don't even know the tip of the iceberg. There is so much profound complexity in what the Almighty has made. And we sitting here look at individual ingredients and think that, that is what matters. Having said that, I'm here to give you a talk on micronutrients. And our micronutrients are macro concern, because anytime you tell somebody to switch to a plant-based diet, they're always worried about these micronutrients. So what are micronutrients? They're elements that are needed in small quantities, but they're critical for our health. They're not made by our body, and their deficiency leads to diseases. So let's start with the big one, vitamin B12, right? Now, it is a water-soluble vitamin with a highly complex structure, but what you need to know is that at the core, there is this cobalt, okay? And this R, which is linked to it, can vary, and based on that, you will have different types of cobalamins, right? Now, quickly a run through how B12 gets absorbed. So B12, when you ingest, the parietal cells secrete intrinsic factor and hydrochloric acid, which breaks down, separates the protein from the B12. Transcobalamin 1 takes it to the duodenum, where the protease enzymes from the pancreas break it up again, and the intrinsic factor takes it down to the ileum, where it gets absorbed, and with the transcobalamin 2, it goes to the liver most of the time. Now, liver is the primary storage site for B12. It stores so much B12 that it can last for years together, which is why B12 deficiency will not manifest immediately. And the recommended levels are above 500, and the RDA is around 2.4 micrograms per day. Now, if you look at the top causes why B12 deficiency occurs, one is, of course, inadequate dietary intake. The other one is malabsorption diseases. So if you look at these, there are, of course, infections occurring, alcohol abuse, smoking, gastritis, and medications. One of the biggest causes today is because of these antacids that are being consumed right, left, and center. Of course, our focus today is on inadequate dietary intake. So let us look into that. Now, B12 is synthesized only by microorganisms, right? And multicellular organisms do not have the genes to prepare B12. Please understand this. So how do we get B12 from plant foods and animal foods? Let's look into it. Well, plant foods used to contain a lot of B12 because it used to be present in the bacteria in the soil, and that is where it used to get absorbed. But now what we are doing, the whole soil is exposed to antibiotics and pesticides, plus we have to adopt these ultra hygienic methods, because there is so much pesticide, antibiotic, that we have to clean them. So that basically eliminates the bacteria which are present. But humans do produce B12. Where? In their large intestines, right? And that is where we have these bacteria which produce B12. Unfortunately, the absorption of B12 occurs in the distal ileum, and that is why it is passed into our feces. Coming back to what Dr. Khanna was talking about, if you want to get your B12, well, there is an option. You can eat the poop, right? Which is what herbivores actually do. And that is why you can get it from there. But humans don't do that unless, as sir has also said, you give it some fancy name, and then you are even willing to pay up to 25,000 per session to get that, do that same thing. right? Of course, there are less exciting ways to get your B12, and that is fortified foods or simply B12 supplements. Now, animals also do not make B12. Please understand this. But the bacteria in their intestines make B12, and they are fortunate to be able to absorb that B12, and that is where they get the B12 from. But to make that B12, what they need is cobalt, which they have to get from the soil. Remember the diagram I showed you, cobalt in the center? And what has happened now? Again, that soil degradation is also depriving them of cobalt. And most livestock animals, from where we get our dairy and meat and everything, no longer feed in the open. So they are not exposed to the soil actually, from where cobalt may be present. So how do the animal products have B12? Very simple. Livestock feed is supplemented either directly with B12 or with cobalt, so that they can make it. Now animals incidentally are also, see, the conditions in which the animals are kept, where they stay, that is where they pee and they poo. Right? So they are unintentionally exposed to feces. So that is where they get from, plus unsanitized water. This is how they stay basically. And some are even intentionally fed manure. Right? Like cows are fed poultry waste. See, you have to recycle whatever you have. It's all a profit-making industry. You don't let anything go waste. Kidhar bhi usko istemal kar lo. So that is how it works. In fact, FDA has found that most meats eaten are now contaminated with fecal bacteria. What is the bottom line? Eat poop, take supplements, or feed the same to animals and then eat the animals. So my preference is we take supplements, right? There are various types of supplements that are available. You can see the range of micrograms which are present. I mean, what is this? 1500 micrograms is like it will last you for 625 days, but does it? No, because the absorption has a limit, okay? Because the intrinsic factor has a limit, how much we can produce. So even if you go on increasing the doses, the absorption is not that much. It's still decent enough. We need only 2.4 micrograms per day, so you can get it, but it's not that great. So you may have to use B12 injections or nasal sprays if you want to reverse a severe deficiency. So 47% of Indians are B12 deficient. Please understand this. Which is why regardless of your diet, just because somebody is having non-veg doesn't mean that he cannot be B12 deficient. So don't be in that impression. Check the B12 levels, take a supplement if needed. Bioavailability from supplements is much more than from foods, and there is no need to consume animal foods for the sake of B12. Right? Let's move on to vitamin D, the sunshine vitamin, right? Now it is actually a hormone, so to speak, because we can make it ourselves when we are exposed to UVB rays. And there is of course vitamin D deficiency is on the rise. Of all the properties that it has, the focus today we are having is on that it promotes the absorption of calcium from the intestine. So a quick look into this. Madam has of course spoken a lot about calcium as well. Whenever there is low calcium in our body, what happens is the parathyroid gland gets stimulated to release parathyroid hormone, which releases calcium from the bone. It increases the calcium reuptake from the kidneys, and it activates vitamin D3, okay, in the kidneys, and that D3 increases the calcium uptake. So these are three ways in which a deficiency of calcium leads to an increased calcium level in the blood, right? Now, if there is vitamin D3 deficiency, then what is going to happen? This loop is going to get blocked. As a result, it leads to what is a secondary hyperparathyroidism. Now the body is secreting more and more parathyroid to increase the other ways of retaining calcium, and that's why calcium starts getting released from the bone, and that leads to osteomalacia and rickets, right? Now, you have to understand, while D3 deficiency is a problem because it's a fat-soluble vitamin, and toxicity could also be a problem. Not very common, but it is possible if you keep taking supplements, right? So the thing about fat-soluble vitamins is that they get stored in our fat. So if somebody has excess fat, then there will be less vitamin D in their blood, right? So obese people would need more vitamin D3. And all research, no matter where you look at it, has shown that those on a plant-based diet have lower BMI, right? So basically the requirement from dietary needs is significantly less as compared to an obese person. Okay. Of course, there are a lot of sources of vitamin D3, sunshine being the best. If you can get it, nothing like it. Let's look into other sources. Like fish also do not synthesize vitamin D. Where do they get it from? They get it from eating the phytoplanktons, which actually make vitamin D from the sunlight. Farm fish obviously will have low D3 levels because they don't have exposure to phytoplanktons. So again, supplements are added to their diet. Egg yolk doesn't have too much of vitamin D, but it's there, and that also depends on the exposure the chicken has had to sunlight. And in poultry industry, we know chickens don't have any exposure. So the yolk is also enriched yolk. So yolk is taken and sunlight is given to it to increase the vitamin D3. Okay. So mushrooms have T2, which is not considered to be as effective as D3, and even commercial grown mushrooms are grown in the dark, right? So even they don't have enough exposure to UV light. They are also enriched in different ways. So we fall back to fortified foods or supplements, right? Again, bottom line, give sunshine to the mushroom, eat the mushroom, or you give sunshine to phytoplanktons, let the fish eat the phytoplanktons, or you give supplements to the fish and then you eat the fish. Or you get the sunshine yourself or you take the supplement yourself. Okay, so you have a choice that you can make, right? Get adequate sunshine, okay? Not too much, risk of skin melanoma, dermatologist here will speak about it. Take supplements as needed, fat soluble, don't overdo it also, check your vitamin D levels and maintain a proper balance, right? What about calcium? I'll briefly touch upon this because D3 and calcium just go hand in hand, you can't just separate them. The recommended daily allowance is around 1000 to 1200 milligrams, but there's now rethinking about this happening, and the NHS and all have said that the recommendations may be too high and the supplements, calcium supplements could do more harm than help. And what is more important, they have said, is vitamin D and exercise. Why exercise? Because exercise, first of all, strengthens bones by stimulating osteoblasts. That itself is a natural way of strengthening the bones. It reduces bone loss, conserves bone tissue, and it gives better balance and coordination, which is, leads to lesser falls and fractures in old age people. So, high calcium intake does not reduce hip fracture risk, as madam has said, and in fact can cause kidney stones, especially if pills are taken, but not so much with food. And now they have given a revised RDA of 700 to 800 milligrams. There are of course many sources in which you can get it. Also, let us look a little bit into this because people are worried that research has shown that vegan diets have a low bone marrow density and higher risk of bone fractures. Now this is in vegans. Now please understand that vegan diet is not equal to a whole food plant-based diet. The difference is, the only common factor is both exclude animal foods, but in a vegan diet, you are allowed to have processed foods, refined products, there's no focus on eating a variety, it's a highly calorie dense diet. And as all previous speakers have shown, a whole food plant-based diet is absolutely anything but this. What about fractures? Who has a greater risk? No, this is not for a prize though. Who has a greater risk of fracture after a fall? Laurel or Hardy? Hardy, because it doesn't have that protection of the fat mask, and those on a plant-based diet will have a lower BMI, they will have a higher risk of fractures, right? So is that a concern? But that same lower BMI puts them at a lower risk for all metabolic diseases. So look at the positives, they far, far outweigh the minor risk of a fracture. And bone fracture, why does it happen on vegetarian and vegan diets? Is because low body mass index, lower intake of nutrients such as calcium, D3 and protein. And we know that a whole food plant-based diet will not make that same mistake, and we can easily cover up all those factors as well. Next we come on to the omega-3 fatty acids, right? Now here, a little bit of a class I'm going to take, and the questions are going to come on this, so please be a little attentive, right? So fatty acids are the building blocks of fat in our bodies, right? And the structure is such that there are these hydrocarbon chains, CH2, 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 depending on the type of fatty acid, you will have different numbers. On one side, you have the carboxyl group, okay? On the other side, you have the methyl group, that is also known as the omega end of the fatty acid. Okay, everybody with me so far? Now there are multiple types of fatty acids, and let us try and understand what these are. A saturated fatty acid is one where the carbons are saturated with hydrogen. So each one has 2 hydrogen linked to it, right? So which basically means all carbons will have single bonds between them. There is no scope for a double bond. That is a saturated fatty acid. Now even if there is a single double bond, okay, then it becomes an unsaturated fatty acid, right? Here there is a double bond because this carbon has only 1 hydrogen attached to it, each one of them, right? Now if there is, what is a monounsaturated fatty acid? When there is only 1 single double bond. If there are 2 double bonds, 2 or more, then it becomes a polyunsaturated fatty acid, right? Is this clear enough? And depending on the location of the first double bond from the omega end, like here 1, 2, 3, you name it as omega 3 or omega 6 or omega 7 or omega 9, whatever, right? So, who's going to attempt this? Somebody has to raise the hand and tell me which type of fatty acid this is. Anybody? Raise hands. Okay. Can you tell me why? Yeah, so correct. So all single bonds. Yeah. Your name, please? Yeah. Okay, next one. Whoever raises the hand first, I'm going to ask, okay? No, not the one who blurts out the answer. Okay, that's saturated fatty. Now, what about this? There, I saw that hand first. Yeah. Wait, nobody. Huh. Can you elaborate further? Yeah, omega 9. Correct. Very good. Your name? Ria. Right? What about this? Yeah. Okay, polyunsaturated. Can you tell me something more? Yeah, but which type of polyunsaturated fatty acid? So it is omega 6, right? Now last one. Sorry, Amit, right? Amit. Huh. Yes, no, not you. Sorry, you have got 2 prizes already. You have also got a prize, no? No. Please try. Yeah. Which one? Okay. All 3, yes. So all of them are omega 3 fatty acids, right? And they have different names based on the number of carbon atoms they have, right? Excellent, very well done. Now, a little more, one more level up, okay? Now, because these hydrogen atoms, if they are on the same side, they push each other, okay? And they cause a kink in the structure. So that becomes a cis configuration, okay? And this is the cis configuration. If the hydrogen atoms are on the opposite side, it becomes a straight chain, and this is known as a trans fatty acid. Okay, so these are more thermodynamically stable, which is why the industry makes these trans fatty acids, because they are good for longer shelf life. Incidentally, in nature, they are also found in the GI tract of ruminants. Therefore, beef and dairy products will have trans fats as well. Good. So now you know fatty acids can be saturated, unsaturated. These can be mono or poly, and then each individual will have their different omega 3s. And unsaturated fatty acid, when processed, gives to trans fatty acid. Great. And trans fatty acids are the worst type of fatty acids out there. 2% increase in calories from trans fat increases 23% risk of cardiovascular disease. Right? Saturated fatty acids are mainly found in animal foods and coconut and palm oils. Less than 6% calories coming from SFA is what is recommended. Subject of large controversies, because there are 2 groups. Some say it doesn't matter, some say it's extremely bad. A lot of things are going on. But this excellent paper was there, and what it told, and it made very logical sense to me, is that what are you replacing these saturated fatty acids with? That is what makes the difference. And if you replace them with refined carbs, then the benefit seen is not much. Okay? But you replace them with healthy polyunsaturated fatty acids, then yes, the benefits are much better. And there's no doubt that unsaturated fatty acids are the healthiest type of fats, mainly found in plant foods. And then you can have monounsaturated fatty acids. The poster boy is the omega-6, and the polyunsaturated fats, where the poster boy is the omega-3, right, which is also found in fatty fish, and we'll come to that. Don't worry about all this. Just remember omega-6, La and AA, and omega-3 you have to remember ALA, EPA and DHA. Now La and ALA are the two essential fatty acids for humans. There's a new kid on the block, C15, which is a little beyond the scope of this. But these are short chain omega-3 fatty acids, and they from them the body can make the long chain omega-3 fatty acids, namely arachidonic acid and EPA and DHA. Right? Now this side, omega-6 is the pro-inflammatory molecules and omega-3 is the anti-inflammatory molecules, which is why a lot of promotion of omega-3 keeps happening. Now this conversion of ALA to EPA and DHA is different in males and females. Okay? In males, only 8% ALA gets converted to EPA. In females, 21%, while ALA to DHA is only 2% in males and 9% in females. Why this discrepancy? Because it depends on estrogen in our body. It also depends on how much ALA we are taking in. And importantly, it also depends on how much omega-6 we are taking. Why? Because if you look at the processing of these two, they share the same enzymes. They have common enzymes. So if omega-6 takes up all the enzymes, the omega-3 conversion will obviously get affected, which is why this omega-6 to omega-3 ratio becomes very important. Those who are having high intakes of omega-6 will not have enough enzymes left to form these EPA and DHA in their body. Right? And if you look at it, Paleolithic times, the proportion was nearly 1. Current USA is like 16:1. Look at Indian rural is 5, but Indian urban is 38:50. So much of omega-6 we are consuming now. And what are the sources of omega-3 fatty acids? ALA, price question. Who can say? These 4 options are there: nuts and seeds, fatty fish, green veggies, meat and dairy. Best sources. Yeah, no, madam, you have answered already. Orange, nuts and seeds. Ma'am, your name? Vidya. Nuts and seeds give you the best form of ALA. Okay, next question, hands ready. Okay. Oops. I don't think you saw that, but I was quick enough. Okay, EPA and DHA is made by ruminants, fatty fish, seaweeds, bacteria. Sir? Fatty fish, yes. Seaweeds. Anybody else? Yeah. What's your name, ma'am? Uditi. Right, so they are called marine omega-3s, but they are made by seaweeds, and fatty fish get it by eating the microalgae and plankton. So we know that fatty fish contain a lot of omega-3s, but they are not the makers of this. It is the plants that make it. Right? And if you look at the RDAs for this omega-3s, you will see that ALA is required in 1.6 per day, grams per day, while EPA and DHA combined are needed 0.25. For pregnant females, the requirement for ALA is 1.4, but combined this is 0.8. So when you say combined, you can have like 50-50 of this. So this is what you need to get. Now let us see how you can get on a plant-based diet, because on a plant-based diet, we are not eating as much of seaweeds, right? So everybody says that have the fish, because only then you will get, or fish oil or whatever, right? So let us understand this. Now we have seen there is a conversion ratio, right? 5%, 2%, 21%, 9%, right? Now what is the ALA equivalent that you will have to take so that the body is able to make its own EPA and DHA, right? So ALA equivalent for ALA obviously will remain the same. For EPA, it will be 2.5 there, it will be 6.25, 2 and 4.5. So if you have so much of ALA, then your body can easily make the required EPA or required DHA. So totally you need around 10 to 11 grams of ALA, and then you don't even need to consume EPA and DHA because your body will only make it. And plus, sorry? So that's the point. And consuming less omega-6 will further improve. So this ratio is variable. If you keep having omega-6 in large amounts, then this will not be valid. So omega-6, the lesser you take omega-6, the better it is for you. And if you look at the flax seeds, hemp seeds, chia seeds, walnuts, they all have a lot of ALA. So if you consume these nuts and seeds, you will be able to make your own EPA and DHA. Of course, supplements are always there. So bottom line, avoid your trans fats. There's no two ways about it. Replace saturated fats with healthier unsaturated fats. Regularly consume your nuts and seeds. Consume less vegetable oils because they have the ones which have omega-6 in them. An adequate ALA with a whole food plant-based diet will provide adequate EPA and DHA as well. A quick look into my diet before we end. This is what I make every day and have this. It's a mix of lot of things inside there. I've done this calculation of how much proteins and stuff I get. This is a smoothie shake that I make, and it has a lot of these stuff. Sorry? Oh, it's peanut butter, raw spinach, banana, soy milk, whatever. So, this is all okay. I take this now once a month, but I keep checking my blood levels and ensure it's all good. And this is a nutritionist.com site is there where you can put what you have taken and you have seen, and I've found that all micronutrients are pretty much well under control. Right? Proteins I'm getting incidentally. I'm not even trying to increase my protein, but it comes to around 1.1 grams per kg per day. So, and all from whole food plant-based. So it's not big of a challenge that people think, where to get your protein from. And I keep regularly checking my blood levels. By God's grace, everything is fine. Last month, in fact, last 6 months, I lost 2 kgs. Okay. Importantly, I did my DEXA scans. I had done it previously and I did it now. And to my pleasant surprise, I have lost 3.2 fat and I have gained 1.2 kg muscle. 47. Okay, so a balanced whole food plant-based diet can provide proper and adequate micronutrients. Supplements are needed for B12 and D3. But you may still argue that why not get that same from animal foods naturally without any supplements? Okay, well, welcome to reality. You know what these are? These are animal livestock supplements. Okay, so what are these? Most widely used supplements, protein supplements given to animals. Please understand, if we think that we are taking proteins from animals, they have to be fed first proteins. Okay, next, calcium, phosphorus, magnesium, sodium, copper, zinc, iron, selenium. What else you want? Vitamin supplements, A, D, E, K, B and C. What else? Probiotic supplements have now gained popularity. What else? Hormonal supplements, estrogen, progesterone, testosterone, growth hormone. Forget about antibiotics and all, that to alag hi ho gaya. So, nothing is natural about micronutrients found in animal foods today. It is better to take the micronutrients from plant foods or supplements. Thank you so much. Absolutely, smoothies are like the best thing ever made by. I didn't get your point. Why would the quantity become less? See, okay, smoothies is different from fruit juices, okay? This needs to be made clear. The juices which are available is basically you squeeze out and just take the fructose syrup which is coming out of the fruits. That is not what is recommended. A smoothie is something where you keep and retain the fiber and all the nutrients which are there. So there's a big difference in the two. You don't chano the smoothie, you have it as it is. You can of course have the fruits directly and you can have them, that is even better, no doubt about it. But making a smoothie is not as bad as a fruit juice.
I missed to introduce and just tell you quickly about Dr. Rupa Shah ma'am and Ila Pathak ma'am. So Rupa ma'am is a lifestyle medicine consultant. She's author of Dairy Alternatives, What About My Calcium, produced Flower Shakti documentary, and Doctor in Me, which released in 2024. She's the chairperson of Pan India Mumbai City chapter. And Ila Pathak, she's his master's in the dietetics and food service management, who both of them showed us the kitchen replacement, certified nutritionist with expertise in the plant-based nutrition, And she practices at KB Health alongside Kajal Bhatia, promoting healthier living through informed dietary choices. Now we will begin with the panel discussion for the second half of the day. And I will give the mic to our moderator, Dr. Kulkarni, sir.
Hello. I know all of you are waiting for your herbal tea or your plant-based coffee or tea, but I won't bore you too much, I promise you. I'm going to show you some nice pictures, that's all. Who doesn't love to be amidst nature, pristine nature? But due to modernization and urbanization, we are moving away from nature, and our fast-paced life has made us shift from a healthy, natural diet to an unhealthy fast food diet, causing many lifestyle disorders. I am fortunate to be a moderator of a panel comprising of esteemed panelists, whom you have already heard. Let me begin the panel discussion with one of my favorite quotes. Society eats so much junk food that eating real healthy food is considered dieting. I'm sure I've been asked this question many times. I'm sure Sharang will also agree. Are you dieting? So because we are eating healthy food.
The best part is it's called junk food, but people take pride in eating it actually. Let's go and have junk food.
Yeah, okay. So let's begin the panel discussion. First question to Rupa Shah madam. Could you elaborate on the correlation between milk and hyperacidity? Because it is said that cold milk is good for the retrosternal burning caused due to hyperacidity.
So this is a popular thing, right? Whenever there is acidity, एक आधा glass ठंडा दूध रात को पिया और मेरा. So that is actually temporary phenomena. You may feel better immediately, but the way milk protein is getting processed inside your body. So the food is not just about what is protein, carbohydrate, fat and all that. It also how it is absorbed in your body, how it is digested in your body, how it is assimilated in your body, and then finally how the waste is eliminated in your body. In this process, the protein, the way it is digested, the acids are formed in the body that I already mentioned in my talk. This is going to cause the internal acidity and then finally irritate your system because it is inflammatory in the nature.
Yeah, true.
And then it causes the hyperacidity once again. So it's a vicious cycle, and too many of our patients, when we tell them to give up dairy products, within weeks the hyperacidity symptoms disappear. And then they start laughing. Oh, I thought I always kept drinking taking ice cream or cold milk. And that's how I thought, my acidity will be under control. They call it as, after all the nice Punjabi spicy food, in the end you have kulfi, right? Neutralizer or something. But that's exactly is the opposite.
Yeah, very true.
I'll just add to that because possibly I see acidity for my bread, butter and jam. So the calcium content of the milk is a very powerful secretagogue to the parietal cell. And the calcium, apart from the standard secretagogues, which is acetylcholine, histamine, other things, calcium is a very strong secretagogue. Yeah. So your hydrochloric acid production actually rebounds and increases. So you initially get because milk is neutral pH, you get a little bit of relief, and the cold temperature also causes some relief in the burning. But otherwise, it's absolutely counterproductive to take milk.
Yeah, so one takeaway from this discussion is that you have to advise acidity patients to stop dairy and not consume milk. Yeah, same thing will hold true for any dairy products.
Milk, calcium would be same, and the other acids, which Dr. Rupa said, is also the same.
Yeah. Yeah, second question to you, Dr. Sharang. Could you elaborate a little about the anti-nutrients like phytates, oxalates, the saponins, which are present in plant-based foods, which are known to affect the absorption of the micronutrients?
So this is a common fear that people have, that these anti-nutrients are going to prevent the absorption. But again, like going back to the first slide I had, there is so much that we don't know about nutrition. These are there probably for a larger purpose. Now there are many studies which have shown benefits also of these same so-called anti-nutrients. So blocking the absorption is just one part of it, but there are other benefits also which are obtained from that. Having said that, simple methods like soaking, boiling or fermenting, these things automatically eliminate the side effects of the anti-nutrients. So that, and we don't actually eat raw things.
Correct.
We have a minimal process which goes on. So that kind of takes care of that.
Yeah, very true. Dr. Kumta, question to you. Is it okay for diabetics to have high carb foods like fruits and potatoes in their reversal journey?
Although fruits are high carb foods, we should understand that they are whole foods with a lot of water, fiber, and all the other macronutrients as well. And the studies have shown that increasing the amount of fruit actually decreases the incidence of diabetes. So, but all diabetics would know that when you consume fruits, your blood sugar does go up. But that can be corrected by going on a low-fat diet. So when you consume high-carb natural foods in the setting of a high-fat diet, which causes insulin resistance, your blood sugar is going to go up. So if you combine it with a low-fat diet, the same thing would not happen. But initially, I think for diabetics, it's better to avoid the high glycemic fruits and to stick to the lower glycemic ones. And the other thing they can do is to also eat some raw vegetables along with the fruits, or maybe some green leaves to decrease the glycemic response.
Yeah, that's true. Dr. Khanna sir, how is the gut microbiome related to obesity?
Very
Could you
interesting.
elaborate on that?
Yeah, very interesting. So you have basically certain families of bacteria in the gut. So you have the Firmicutes, you have the Bacteroides, and a few others. So if you get an abnormal ratio of Firmicutes to Bacteroides, then the Firmicutes has a property that it will absorb calories even from waste. So if you are getting an excessive amount of Firmicutes, even from the end products of digestion, calories will be absorbed. So they have found that when you have this ratio, nowadays they are called Bacillota to Bacteroids ratio, you will get an excessive amount of calories being taken in, and that is why patients will tell you that they eat salad and still gain weight. So that is because of the abnormal
gut microbiota
which they are having.
Yeah, that's interesting.
Yeah. Plus a lot of foods which we are eating is disturbing this microbiome, especially glyphosates, which are there in a lot of
pesticides.
Food, the pesticide, and that is causing.
True. Before the next round, I would like to quote an Egyptian proverb: "1/4 of what you eat keeps you alive. The other 3/4 keeps your doctor alive." That is what we have been doing all these years. Next question to you, Dr. Rupasha. It's generally believed that milk is good for osteoporosis. Could you explain the true facts? I think you have already mentioned that in your talk. Yeah, okay.
We can also let them ask questions.
Okay. I think one interesting question for Dr. Sharang. It's not been covered in his talk. Can you elaborate on iron deficiency? We know that it's a big health problem, and the non-heme iron found in plant foods is difficult to absorb compared to the heme iron found in animal products.
So obviously heme iron absorption is much better than non-heme iron. And interestingly, depending on your body requirements, the non-heme iron absorption varies. So if you have low iron, then more non-heme iron will get absorbed. But the reverse is not true. For heme iron, whether you are deficient or you have iron, it will just keep getting absorbed. Okay, that is one part. Secondly, as I had shown during my previous talk on proteins, heme iron is not necessarily all good. It has been linked with higher risks of colon cancer as well. Okay, so too much of heme iron is also not good. So I feel somewhere there is a balance which is required in all kinds of nutrients that we are taking. As far as deficiency is concerned, the problem is because nobody in general is having whole food plant-based diet. So all your beans, lentils, tofu, all these things have a lot of iron in them. But what we are consuming is mainly cereals.
Right.
So majority, so that is where the shift has to come from, having more healthier foods which have more of these micronutrients.
Correct. Dr. Kumta, you said that fat is the cause of type 2 diabetes mellitus and the cause of insulin resistance. Does that mean that we should stay off nuts and seeds which are high in fats?
We should go on a low-fat diet by eliminating animal products and by eliminating oil from our diet. But the body does require some healthy fats, so we should include a small handful of nuts and seeds to get this. It should be from whole plant foods and not from processed foods like oil.
Yeah, okay. Even the largest and the strongest animal on the earth eats a plant-based diet. Talking about strength and proteins, Dr. Rupasha, it is said that paneer is a very, very good source of protein for vegetarians. And you see vegetarians eating paneer, butter masala and paneer makhani everywhere. You go to any buffets, paneer is always there in the buffet among the 3 vegetables. So can you elaborate on this paneer?
That is only for taste. Huh? Nobody is having that for proteins.
No, for protein also, like, one doctor told my mother-in-law to have protein, paneer every day. So since you are a vegetarian.
I'm talking of the buffet.
Buffet. So 2 things, every dairy product has something to market it properly so that you can have it. You agree with me? You have to find out, paneer, chalo, let's market it. So they'll say, protein, vegetarians don't get protein, so paneer khao. Also, that is the real paneer. There is also a lot of parallel industry about this analog paneer in the market. Sometimes tofu is pushed as paneer also. So that's another story altogether. Tofu, of course, is the best one for the protein and not paneer. But paneer contains exactly the same thing that you all answered me, today. What is in the glass of milk?
Only more concentration.
More concentration, yes, absolutely right. So you're going to get bigger dose of all that. You have to not see food as protein, carbs or fat. You don't see animals carrying a chart with calories and then selecting a food in the nature. They just graze and they eat only what is their food. If you give animals something else to eat, they will not eat. Have you seen it? Yeah, they will not. They will only eat their food. They'll walk and identify and eat what is their food. But we are the only one who think that we can eat anything, so we'll start eating, and then this protein, something has to be marketed like that. But tofu is far better source of protein than paneer. And paneer was more like cottage cheese, more in Punjabis, like, North India. I don't remember 30 years ago, we as Gujaratis ate paneer. Only lately, then it got introduced, and then Jains, we are Jains also. So paneer ka ek sabji is, goes with Jainism. So paneer sabji is always there at our temple food, always there. Then this analog paneer being so cheaply available, like 250 rupees a kilo, which is a fake paneer, okay? It is a fake paneer. And the restaurants and in the roadside vendors, they are all buying it. And then they are feeding us with that paneer also.
True.
So any food that is cheaply available will be then consumed by all of us also.
Yeah.
The protein and paneer not correct.
There's one point about marketing, we have to be very careful.
Last
because
question to you.
initially people used to have raw milk. Then pasteurization came in and they said, okay, let's have pasteurized milk. Then they said, okay, this is high fat. Then they came skimmed milk started coming. So every time new type of milk is being introduced, suddenly the milk industry, dairy industry themselves start blaming the earlier version. So the skimmed milk, people said, oh, high fat is all bad, don't have that, don't have that. Now they have come up with A2 milk. So now they are suddenly saying, oh, A2 is all bad, A2 is bad. So far they were selling A2, now they have to sell A1. Now they have to sell A2, so now they are blaming they are revealing the problems with A1.
A1.
Now again the new marketing has come, raw milk. We have completed a cycle. Now again they are saying have raw milk because all this A1, A2 is all processed and it is all bad, and Now the dairy industry is only coming out with their studies showing that all this is bad. So we just have to look beyond that marketing part and see what actually is the real stuff. Frank?
When you buy non-dairy milk from outside, like millet milk and oat milk and all, and that comes to Tetra packs, aren't these packaged? So
Which is
two
why
problems.
we showed that.
That's why I made soy milk at home, right? You saw it. Those are transition. The thing is this, I've been now 16 years dairy free. I don't have that white looking liquid every single day in my home. That habit is totally gone. We are, as soon as one milk goes, you start looking for all these alternatives. Kuch pina chahiye, hona chahiye, white hona. We hardly need this milk. Or the only thing I ever have is little bit of curd that is made from non-dairy, right? I make from groundnut. So these are transition foods. We don't want to trouble our environment by those Tetra packs. In my house, I hardly ever have them. I don't buy Tetra packs. I make at home if I need it. I hardly make it. There are many other dishes. So we are not encouraging people to have those processed plant-based milks at all. That's another industry. It's already $1 billion industry in US. But we milk-loving country. We love our dahi. We want chash. We want our butter. We want everything. So we start looking for. Let me tell you, Indian market is geared up now. We have everything available, including 10 vegan companies marketing ice creams in India. Vegan ice creams. Okay, they are available if you want to have them. I hardly have them because you don't need after some. There's also one just more thing I wanted to say. There's something called as food addiction and satiety. Satiety के शब्द क्या है हमारे language में? तृप्ति. Have you heard of this word? खाना खाया तृप्ति. Param trupti. Param means no? Ultimate, like so jao kind of. Santrupti. Santrupti means fully satisfied. Santosh, that is the word. So the food addiction, all the foods that we are eating are addicting us. But when you go on a whole food plant-based diet, nothing addicts you. Food doesn't call you. Food doesn't have power over you. You will not have tomatoes one day from your refrigerator calling you, eat me, eat me. The chocolates will call you. So that is a great advantage that now you are empowered, not the food that is having power over you. So I tell people, whether the food that you eat has power over you or you have power over that food. This is what is empowering is all about, okay?
Yeah, one point I want to make about addiction. Casein in dairy milk gets converted to casomorphins on digestion or by processing, and that is very addictive. So you see kids now, even young generation adolescents, having cheese in burgers. Of course, it was always there. In pizzas, it was there. Now you have cheese uttappas, you have cheese dosas, you have cheese everything. And roadside, you will see that fellow putting cheese like this, dollops of cheese on everything. You will have cheese in your wraps and everything there is cheese because it is addictive. So you have to get away from it. So it's very difficult to convince the kids to go without cheese.
See, we have to understand one very simple concept that milk, by definition, is a secretion of a mother for the infant.
Correct.
Till the time the infant can start eating food on its own. And the purpose of that casein is so that the baby keeps coming back to the mother to have that milk.
Yeah.
So there is a purpose for that addiction there in that time. But we are continuing as adults to still consume milk of another species, that too. So milk actually is not a food at all. Please understand this, because you asked that question. We think that मैं दूध छोड़ रही हूँ या छोड़ रहा हूँ तो मुझे replacement क्या चाहिए? Actually आप छोड़ना है क्योंकि आप बच्चे नहीं हैं अभी. We have adults, so we have to eat food, and we don't have to. But
very well said. Very well said, Dr. Sharan.
हाँ, we say ना दूध पीता बच्चा है क्या तू? But still we continue to have. In fact, there was a story where Ayushman Khurrana accidentally or what, I don't know, drank his wife's breast milk which was kept in the fridge. And there was a big uproar. उसने human का दूध पिया. I mean, that was a shocker. ये नहीं कि हम रोज गाय का दूध पी रहे हैं, which is so much hammered into our heads. Okay? That is normal. It is the most unnatural thing if you look at it. A different species, कुछ अपना लेना देना नहीं, लेकिन हम पिए जा रहे. And actually we think we are dependent on that. ये नहीं कि चलो अच्छा है कभी पी लिया, नहीं, we feel कि नहीं लेंगे तो मर जाएंगे. That is the level of brainwashing that the industry is capable of doing.
Correct.
बचपन से हम सुनते हैं cow gives milk, sheep gives wool, ऐसा सब चालू रहता है.
Yeah, Khanna sir, you wanted a...
Yeah, just to add to what madam said, you asked about oat milk. Yeah, so whenever you take a Tetra Pak or something, one thing you just read the label. It is not even 10 or 15% of the ingredient. So most oat milks which you take are 10 or 12%. So you're not getting. The way she made the milk was almost, I don't know, must be all 100%. Okay?
No, we can control that.
Yeah.
That's the best part. You put
Exactly.
more, you get thicker and creamier milk. You put less, you can get more water.
No, what I want to really tell her is that you are getting a package with emulsifiers, with stabilizers,
additives,
which are toxic to your gut. Okay, which will take away your gut mucus, which will alter your microbiome. So don't do that.
Yeah.
think
Questions
we'll
from the audience,
yeah.
please. Yeah.
So I would like all the masters to address this one elephant in the room, which is GMO foods, which I haven't heard in the entire day from anybody. Like we are recommending soy here, but then nobody is talking about the GMO foods.
Sarang, can you take this?
Yeah, I can take. Yeah, sure. So, 80% of the soy that is grown across the globe is fed to animals. Okay, and majority of this animal feed soy is GMO. In India, yet the GMO has not come that much in you, and those labels are there, non-GMO and everything is written on that. But we have to understand it is all that GMO food is going to the animals. The majority of deforestation which is occurring in the name of soy is actually for the animal industry. We are not consuming that. So that same GMO soy is getting concentrated into the animals, and then we are eating the animal foods. So that is how it is coming into us, not by consuming directly soya beans.
Yeah.
In the whole session, we have not discussed the role of probiotics. Could anyone just elaborate on it? And since what are the means of making probiotics and
Yeah. Khanna sir, can you take that?
fibers itself is probiotic, no?
Yes, sir had mentioned that in his talk.
Yeah, I think I have a brilliant student here.
Dr. Smriti will take that. She's an expert in pre, pro and post. All biotics.
I'll just quickly tell you, which I always explain to my patients also. So basically, we have to remember three terms: prebiotics, probiotics, and postbiotics, right? So gut bacteria, they need food. So the food for gut bacteria is prebiotics. Prebiotics are the food with fiber. Fiber is there in whole plants, which is whole grains, cereals, millets, legumes, nuts and seeds, vegetables and fruits. Then there are probiotics. Probiotics are the foods which have live bacteria in them, which are your pickles, your kanji, which you make carrot or beetroot ka jo kanji banate hain, ambali, South Indians they make it, you fermented rice, fermented millets, sakarkat, kimchi and all, and curds, plant-based curds and all. So they have probiotics. Hanji sir? Sir, alcohol is an addiction. So, although, as Blue Zones say, you cannot call it like a food. You can just, I'll never support alcohol. So the probiotics will replenish the gut bacteria faster, but as the sir said, that the base has to be of the prebiotics. Right. Then comes the postbiotics. Postbiotics are the fermented foods which are cooked. So you are making the bacteria, you are cooking it, then you create end products of the bacteria, they replenish your gut bacterial lining faster. These are our idli, dosa, uttapa, dhokla, and everything which is there in our dietary regimes. So if our diet has whole plants as prebiotics, some probiotics as pickle, thoda sa, and lots of fermented foods 2 to 3 times in a week, we are sorted for our gut bacteria.
Very, very well said. Very well said. Yeah.
Since we are saying that saturated fat should be avoided, what about coconut oil as a means of saturated fat for the vegetarians.
I would also like to continue with this question. Dr. Anil Boraskar, he is a diabetic secretary of Diabetic Association of India, senior most diabetologist. They have done a lot of trials in Ramija Hospital, and they have proven in their trials that coconut oil and ghee made in a Vedic method, they are better. Like, you know, the ghee has got omega-6 to omega-3 ratio 6:1.
Yeah.
Ideal should be 4:1. When in sunflower and safflower, it has got a ratio of 40:1. Although sunflower, safflower, plant-based oil do not contain any kind of cholesterol, but they are inflammatory. Second thing, there is a journal called Lipids in Health and Diseases. They have got a trial, reports, high conjugated linoleic acid and enriched ghee increases the antioxidant and anti-atherogenic potency. So there are a number of, you know, the potential benefits of the ghee. I have got all the records. There are certain papers which also prove that ghee has anti-cancerous properties. You know, it metabolizes the carcinogenic metabolism enzyme in the body. So you all are actually inspiration for me. I am practicing for last 30 years and becoming, you know, plant-based diet for last 4 months, even almost 300 plus patients, you know, plant-based. But this question I'm asking, I want to learn, I want to more practice more empathetically. So ghee, I being an Ayurveda practitioner, and ghee is a part and, you know, our therapy. So small amount of ghee, I will take care of animal cruelty. I also belong to farmers family. So we know how to nurture, you know, cow and all like a mother. So if we take into consideration that cow is nurtured well, properly, and milk is taken, and ghee is made as per the fermentation method, which contains pre-probiotic both, and in a small quantity, in a patient, if I decide that he is apt for the ghee, is it wrong?
Sir, I was with you till you were talking about the nutritional benefits of ghee. But the moment you said about cruelty, it is, no. No, but see, if there is no way you can justify taking the milk, if you say you are keeping it like our mother, we don't take our mother's milk like this. So, as far as cruelty to the animal is concerned, there is absolutely no argument that any form of dairy or dairy products is going to cause suffering to an animal which is needless.
Correct.
Okay, there is no doubt about it. There is nothing like Sattvic milk.
One udder is given to the cow's calf, he drinks, remaining 3 udders, you know, the milk is done, not machine, with the hand. Now, if you do not take it out, that cow will suffer from the breast like this. Sir, this I have seen. And the cow produces so much of the milk, the bachur drinks, he will die.
We are diverting from the main nutrition topic.
Forget animal cruelty, but about the medicine, about the science, that he has got anti-atherosclerotic property. It is rich in omega-6, omega-3 ratio is good. And these are not my words. These are from the stalwarts like Anil Boraskar and all other. The trials are done at Raheja Hospital.
I think this animal cruelty aspect is not part of our today's CME, so let's not go into the animal cruelty and ethical part of it. So if you can just talk one few sentences about the nutritional aspect.
No, just quickly I'm going to end this. Ghee, the word ghee is given from India to the world, correct? The rest of the population of the world does not know what is ghee. Are their joints bad? Are they have any all those concepts that we have? They are also living very well, no, without taking any drop of ghee. Ghee is Indian obsession and Indian concept. Plus all this research done in the whole form. Read the book by Dr. Colin Campbell. The second book he wrote is called as Whole. Whenever we do reductionist approach of A element or B thing, this thing, there is bound to be fault in that study because you have, you know, forgotten the whole picture. Please read that book. About every study that, you know, we are discussing endlessly, which are all linear, you will not be able to come to a correct conclusion. There are many other holistic factors that have to be taken for any study. So I would like to, we are not going to discuss the cruelty part today here. I'm sorry about that. And your arguments are taken. You from Ayurvedic tradition, you come from India. Yes, excuse me. We have Dr. Prabhu here who will dissect every damn study and he'll tell you who funded it, how this happened.
So,
So can I say something about the studies? Pretty much all my career, I'm a research pathologist. So all my career, all I did was look at study. I was dreaming of studies. So I used to teach looking at good science from bad science at NIH. And NIH is like the gold standard, right? Everybody admits. And there, I used to show people, my students, postdoctoral students, I would show them, this study says, if you look at in the 30s, 40s, smoking is fantastic. And then you look at some of the other aspects, either the design of the study. For example, I'll give you an example. They've shown that egg can reduce, consuming eggs can reduce your cholesterol. The way they did that is not by it's a clever way of designing the experiment in such a way that you can show, I don't want to go into the details, but you can actually show that, number one. Number two, a lot of times these guys hide, their true affiliations. Maybe not in this case, I do not know. Then there are sample studies, like, how many samples, like this lady was saying, how many samples are involved? Is it a really true randomized controlled trial, double-blinded? Is it a longitudinal study? There's a lot more that goes into a study than just saying, yes, here is a study. Unfortunately, I would love for you to share with me.
Master is a highly respected person, and the studies done at Raheja.
Yeah, I understand.
Sir, I would suggest we will look at the studies.
Yeah, I would look at the study.
No, you please,
Let's take this offline.
Dr. Nitin, you please send the studies to Dr. Prabhu and he'll analyze those studies and then we'll get back to you.
I'll do it for you, I promise.
Okay.
Yeah.
Getting back to my question on just two quick questions. One is on coconut oil, your view on coconut oil, since it's touted to be a healthy option, and I also believe it's a healthier choice. And secondly, would you suggest probiotic supplements? And which probiotic supplements, like say, there are so many in the market that could be there. So what kind of specific bacteria could be taken?
No, I think Dr. Smruti has made it very clear that if you are having a whole food plant-based diet with little bit of probiotics as your pickles or your kombuchas or whatever you make at home, then kanjis and all, you should be quite okay with it. Because there are so many kombuchas, kefirs and whatnot is available in the market and you'll go crazy. So you need definitely probiotics. Dr. Khanna, you would like to add?
I did my endoscopic training in Germany where sauerkraut is a very, almost a home thing. It's very simple to make. You take raw cabbage, chop it finely, add vinegar and add whatever other spices you want to add, rye, this, that. Put it on in a bottle, put a muslin cloth on top and expose it to the sun.
3 to 4 days.
Yes, that's all. You get sauerkraut, you can make it beautifully at home. And that's a very good probiotic, okay? The Germans had it during World War II. It was a staple food which they carried along and ate it, and it also suppresses appetite to some extent. About coconut oil, I'm not a cardiologist, and that's where the main crush will come, but 2020 Circulation, which is a very well recognized journal from US, says that coconut oil is very high in saturated fat.
True, very
saturated fats can be taken up to 7% of our total fat content. We
Yes.
stick to a 50-30-20 ratio. 50 carbohydrate, 30 fat and 20 protein. In that 37% you can take as saturated fat, whether you take it as coconut oil, whether if you prove tomorrow ghee is good, you take it as ghee, you take it as avocado, you take it as whatever. There's no controversy.
Very
on that.
true.
There you are.
But excess of coconut oil will definitely be harmful.
Yes, yes. So you stick to that.
One point is that, again, the whole food is coconut. So when you grate the coconut on your salad, you can never overeat it. But when you are having a coconut oil with talawa banana fries, you just do not know where you go. So then that 7% calculation won't come, but with coconut grated, the satiety will come and you can never overeat. That's one. Secondly, about the probiotic supplements, there's something called as microbial overloading. That can happen when you are just giving a supplement with one particular bacteria in that supplement. Instead, if you take it as a food, your body has the wisdom to create the bacterial millions and trillions of the species that they have to create. So
the one line is, supplements are not substitutes of food. They are supplements to be taken for short duration of time.
Very true. Very well said. Any other question? Yeah. So I think we'll end this with just few pictures, which will lighten up the mood. Humans and monkeys share a common ancestor. Monkeys, even in this era, are eating fresh fruits and green leaves. You can even see the birds enjoying papaya as fresh as it can get. Whereas we humans have progressed to eat pizzas, burgers, vada paos, chicken legs, mutton chops, and fish fingers, rather than eating this lovely spread of whole food plant-based meals all made by me and my wife. So let's start enjoying a healthy life by eating a healthy whole food plant-based diet. It's a new dawn, it's a new day, and hope it's a new life for all of you and your patients. Thank you.
Just 1 minute, please wait. Last prize distribution. We'll just quickly give away the prizes.
Just like after every annual function, we have a prize distribution ceremony. All the winners eagerly waiting.
Panesh Chinoy. Congratulations. Trisha Parikh. She's here. Pallavi Choradia. Pallavi. Dr. Kamlesh Haria. Vasundhara. Is Vasundhara here? Chirag. Priya Shanbag. Is Priya here? Priya Shanbag. No. Dr. Shobha. Dr. Shikha. Mansi. Mansi is here. Leera. Congratulations. Dr. Ria. Dr. Anuja. Anuja is here. Dr. Vidya, Dr. Uditi. Dr. Amit. Dr. Udit. Prasanna Deshmukh. Prasanna is here. Please come. These are the early bird. Early bird gets a bird. Kalpana. Kalpana Makode. Kalpana Mare. Nirmala Gulati and Shalu Bhutan. They are there.
Okay, I'll end with this. आप सब लोगों का अटेंशन चाहती हूँ एक लाइन के लिए. उजाले अपनी यादों के हमारे साथ रहने दो. उजाले अपनी यादों के हमारे साथ रहने दो. न जाने जिंदगी की किस गली में शाम हो जाए. हमसे हुई किसी भी भूल के लिए हम करबद्ध होकर क्षमा याचना करते हैं. केवल और केवल मधुर स्मृतियाँ लेकर ही यहाँ से विदा होइएगा. I want to thank the whole of the Nanavati Hospital, Dr. Deepak Patkar, Dr. Vivek Mangladembi ma'am of the administration, Shraddha Adarkar from the marketing, who's been the constant support in planning and execution over last 2 months, Chetan Patel ji for the food and beverages, for curating a whole plant-based delicious menu, Sai Ganesh Caterers. I think we all loved the teas there. Audio visual partners and videographer Mr. Bhavesh Rathod ji. Pan India team, Rinki Singh, the executive director of Pan India, and the whole of the team, Dr. Regina, Shruti and Bhavani, who are not there in person, but they have been the constant support. Mumbai Pan team under the leadership of Dr. Rupa ma'am and the delegates for such an interactive audience. Thank you so much.